Welcome to the 2024 virtual passages. We're so excited that you all could join us here today. My name is Naomi Davis, and I am the current president of MWRAMTAS. We're going to be getting started here in just a moment with an initial breakout room. Looks like some folks from UMKC are joining us. But throughout today, we'll be moving in and out of breakout rooms for sessions and conversation and connection with each other. I'm going to put a file in the chat that is our program for today, but I believe it can also be found on our website. Grace, correct me if I'm wrong. Maybe not. That's okay.
Is that
It's
in the
in the
drive?
chat.
It's
And
in the
you can
chat.
access.
It'll be on our website in 5 seconds.
Okay, that's okay. It's in the chat. You can access it there for now and soon to be on our website. But where you want to get started with just some initial chatting with each other, getting to know each other a little bit. So this morning, we're going to ask that you sort yourself into a breakout room. If you are not sure how to do that, just let me know and I can move you into a breakout room, but we're going to just be chatting with each other. If you could share your name, your school, and a hobby that you have outside of music therapy or music in general. So I'm going to go ahead and open up those breakout rooms. And again, feel free to sort yourself into them. There will just be 4. So you can assign yourself, or if you can't, let me know and I can move you. And we'll plan to be in the breakout rooms for about 5 to 8 minutes. So we'll see you back here in just a few.
Virtual. Awesome. Okay. Hi, everyone. Good morning, bright and early. I'm Grace Stuewe. This is
Haile Ward.
And
Ananya.
Ananya. This is our presentation titled Impact of Synchronous and Asynchronous Music on Visual Working Memory. So for a little bit of background on this, ooh, sorry, I might have to fix the screen a little. Okay,
It's fine on your computer. It's just this way.
So for a little bit of background on our research, our 2 main constructs were working memory and entrainment. We chose these constructs because when we knew we had an EEG lab, we knew in the lab we had software that was similar to an NBAC. And we were interested in doing some kind of entrainment research, and we looked into cognitive constructs, and working memory wasn't one that had been studied well. Working memory, what is it? Basically, perception and long-term memory work together under the constraint of a limited time capacity. We know that rhythm in music promotes predictability, and we call that entrainment. And we know that regularity is a determining factor for auditory predictability and could, we hypothesized, help improve reaction times and or accuracy.
Because our study does use EEG, I wanted to give some background on what EEG is. Electroencephalography, we can break down the word. Electro, pretty self-explanatory, it means electricity. Encephalo relates to the brain, and then gram or graph is a reading or a report of something. So in EEG research, we put a cap on the head. It's non-invasive, it's perfectly safe. And the cap ours has 64 sensors, and we use gel to create a liquid wire between the scalp and the sensors that picks up the electrical impulses in your brain. This is how your brain communicates, is by sending electrical impulses. So EEG takes those electrical impulses and morphs it into a visual waveform, which is what you see on the screen here. So what you see is what a raw EEG recording would look like. And those many, many lines are all the different little spots on your scalp. And then we can do different processes to look at specific things, which I will talk about in the next slide. So for our study, we decided to examine event-related potentials, otherwise known as ERPs. And essentially, an event-related potential is anytime you see or hear a stimulus, it is the 400 milliseconds after that. And what they've found is there's a general trend of peaks and valleys that you can see there on the slide that happen with your electrical impulses when you see or hear a stimulus. For the sake of our study, we used a visual stimulus, so I'm going to refer to it as a visual stimulus. So if you look at the graph there, our peaks we label with P because they are positive, and the valleys we label with N for negative. So an ERP contains P1, P2, and P3, and N1, N2, N3. On the bottom axis there, you've got time in milliseconds, and on the y-axis, you've got the voltage or the electricity. So there have been some hypotheses on what the different components of an ERP represent. If 0 is where you see the stimulus, then P1 is where you process what you are seeing. P2 is where you match it with your stored memory, and then P3 is where you update your working memory with the information that you've seen, and that occurs between 300 and 400 milliseconds. For some context, that is about the time it takes for you to blink your eye. So your brain is working very, very fast, which is really cool, but the ERP lets us examine exactly what's happening, and the amplitude or the height of those Ps has kind of been hypothesized to relate with activity or work in the brain. So the higher the amplitude, the harder your brain is working.
So what ERPs were we looking at? Specifically, we were looking at P2 and P3, like what Haile said about the P3 component, being that memory updating. Makes sense that that's the more studied component for working memory and cognitive attention. And then we also looked at the P2, which is associated with top-down attentional control and processing, and also the primary sensor cortices. So if you're looking at that little 3-wave graphic that we had on the last page, that would be the second bump and the third bump. So entrainment has been studied in speech and motor domains pretty well, but in the cognitive domain, research is pretty limited. So we decided to examine the effects of asynchronous versus synchronous music on working memory via EEG.
Okay, so just as Grace said, we are studying the impact of synchronous versus asynchronous music on a cognitive task. Can you hear me? You can't hear me. You can hear me? Okay, perfect. Just wanted to make sure that it's working. All right, so we had 3 primary research questions. One focusing on, does synchrony of music impact reaction time on a working memory task? Does synchrony of music impact accuracy on a working memory task? And lastly, what is the impact of synchronous versus asynchronous music on brain activity? So in terms of method here, we had 20 neurotypical adults between the ages 18 and 39, 14 assigned female at birth and 6 assigned male at birth. And they had no history of mental illnesses or neurodevelopmental disabilities, since their brains might function differently than neurotypical people. And we used a within subject design. So that means we randomized all the participants into 2 groups. So we had 10 participants in each group, and we counterbalanced the order. So that means that some participants received synchronous music first and then received the asynchronous music first, whereas the other group received synchronous music first and then asynchronous music first. So we counterbalanced that so that the order of the stimulus they received did not have an effect on the EEG reading. So this is a neat little graph of our process. So we started off with a screening in a musical background where we asked them about their history with music and dance just to get an idea. And then we had the actual experiment, and then we had a post-run study where we asked them how their experience was with the experiment, and just to gather some qualitative data throughout this. So we had 3 conditions: no music condition, synchronous music condition, and asynchronous music condition. So for the synchronous music condition, researchers created a lo-fi music track So we created lo-fi music tracks just to replicate music that people might listen to while they study or do tasks related to school or non-related to school. And we had 90 beats per minute. And so this track was then modified a little bit for the asynchronous music so that it was the same track, but it was offset by 400 milliseconds from the visual stimulus that they received on the monitor, which I will be explaining in just a second here. So the actual task that participants were asked to do, they were sat in front of a monitor and they received visual stimulus on this monitor. And so the visual stimulus were numbers. Numbers popped up at the screen, and when they had 3 odd numbers in a row, they were asked to click a certain button on the keyboard. So they all had a practice run before we collected data just to make sure that everyone got a hang of the task. And the total task time took 7 minutes. So that was the synchronous, asynchronous, and no music in whatever order that was. All that took 7 minutes total. And yeah, here's some other information about how many even numbers popped up, how many first odd numbers popped up, how many second odd numbers, how many third odd numbers, all of that good stuff.
This is just some technical information about our EEG system. It samples at a rate of 2,048 times per second, so it updates that brainwave value over 2,000 times every second, which gives us a very clear reading. We have 64 scalp sites as well as facial sensors, and then we put it through a filter. The rest of that information is just technical information that tells you that we filtered out all of the extraneous noise that didn't pertain to what we wanted to look at. So we took out like muscle movements from their face because that affects EEG. We took out the electrical signal that was happening in the room, those kinds of things.
Okay. In terms of P2, we studied the amplitude and found that there was no significant difference between the 3 conditions, the no music, synchronous music, and asynchronous music. And just a reminder that P2 was studying the cognitive matching with stored memory, so we did not find any significance in that area with our study.
So in our P3 peak-to-peak amplitudes, that was that third bump that correlates with updating your working memory. We found that on the third odd, which is when they actually need to push the button, when they see that third consecutive odd, and they go, yep, and they push the button, we did find a significance in our repeated measures ANOVA. So we completed a post hoc analysis using a 2 keys analysis, and we found that where the difference occurred was between baseline, so no music, and synchronous music, as well as baseline and synchronous music. So while there wasn't a huge difference between the synchronous and asynchronous music, it was pretty evident that the amplitude was significantly lower when there was music present.
Going back, I seem to have skipped a slide. Thank you, Grace.
So our behavioral results, the summary of it is we didn't find significance for either response time or response accuracy. I just wanted to go back and go over that.
So this is a CSD map. It kind of maps out the activity in the brain, and you can see that it reflects our data analysis. At the second odd, we didn't really see any significance, which is why all 3 of those images in the first row look really similar. But at the third odd, when they have to actually push that button, and when they update their working memory, you can see a significant difference between the no music condition and the music conditions. In the no music condition, there's a lot of red, which means a lot of activation in that right parietal lobe. But under the music conditions, you can see that it's more orange, not quite as deep of a red, which means there's significantly less activation in that area of the brain.
So what does it all mean? Even though we didn't find significance for response times, we did note that response times were fastest under the baseline condition and slowest under the asynchronous condition, which could suggest that music is a distracting stimulus when completing a cognitive task. We also didn't find any significance for response error, which could suggest that music doesn't have an effect on the accuracy of cognitive tasks. So the significant decrease in the P3 between baseline and both music conditions could indicate that you're exerting less neural effort with the presence of music while completing a cognitive task, specifically in this research, a visual working memory task. So this finding is reflected in the CST brain images, and this shows less activation in the central region for the synchronous condition. Our limitations: this study had a small sample size, and larger sample sizes should be used in the future, and we didn't account for music preference and experience. So our future directions, we are still recruiting. We're trying to get up to 30 to help increase the statistical power by increasing the sample size. We may also stratify by musical experience to further refine our results. And then we also suggest replication, since we found that significance for the P3, showing that cognitive load can be reduced in the presence of music when doing a visual working memory task. So replication on this finding would be ideal. And then we're also hoping that in the future this concept can be applied to clinical research to see how this finding could be applied in a clinical context, as we are all practicing music therapists, and that's the important stuff. All right. Any questions? Thanks. Not me making you clap. Any questions from you?
Yeah, in the room.
That's okay if not.
I think so.
What about in our Zoom room? Cool beans. What is the
Context of this study.
What is the context of this study? Undergrad? No, so we're graduate students. So graduate research, and then
Yeah.
Blythe is on this one too.
Yeah, this came out of we were taking a graduate research course with our director last spring. Long time
it's
ago.
been a while.
And it was a pretty small class, so she offered us the opportunity to either do a big research project or take finals, and we were like, we'd rather do a research project. So we ended up doing a semester long, and it has been a huge project. Like I said, we're still recruiting participants a year later. So, but yeah, it's been a great learning process, and we've learned about the EEG lab here at CSU, which is really neat. And yeah,
If you want to
Great
learn
question.
more about it, sorry.
go ahead.
If you want to learn more about it, you can look up brainwaves CSU. Yep, we got a few studies going on, but this is our only study.
Awesome. Thank you so much. Okay, y'all, we're gonna move on to our second block of student presentations, and we'll have two going on at once. If you are interested in checking out Megan Westphal's presentation on supporting gray matter recovery in typical anorexia nervosa through music therapy, stay in here. If you are interested in hearing Sydney Winders talk about understanding cognitive behavioral therapy, please click that second Zoom link. So that just went in the chat. We'll be splitting into two presentations for just this next 15 minutes, and then coming back to this main Zoom following that student presentation. So we'll give you about 2 to 3 minutes to transition over to the second Zoom with Sydney, and otherwise hang out here. Thanks, y'all.
Everyone. This is my presentation on supporting gray matter recovery in typical anorexia nervosa through music therapy. And so it's basically like a research synthesis project that I've completed. and so I'm excited to talk about this with you today. As we get started, just a few things that will be important to note are that we will be discussing eating disorders. So there, we'll get into things a little bit, so that could be activating. And we'll be talking a little bit about weight and things like intake, but there will be no specific numbers. So first, it's important to kind of recognize the diagnostic criteria from the DSM. So for anorexia nervosa, you have a restriction of energy intake that is a lot compared to someone's age, sexual or physical health, developmental trajectory, things like that. And we also see an intense fear of gaining weight or becoming fat, even if underweight. And then also we see some body image disturbances and how one perceives their weight or their shape or how it's experienced. So we'll also be talking a little bit about atypical anorexia, which is when an individual is diagnosed with having these same 3 symptoms, except for that weight loss factor, where it's not significantly low enough that it would mean that someone would need to be like weight restored through like renutrition. So this is an example of like what the brain might look like of an anorexic patient with like acute anorexia. So you can sort of see some of like the white color, and I know it's a little bit hard to see, but that will show you some of these gray matter decreases that we see in the brain. And the gray matter is made up of those different neuronal bodies, cell bodies that we have. And it's really important for many, many things. And gray matter is also spread like throughout the brain. So when a person has a lot of weight loss, then we're going to see a decrease in gray matter. And for anorexia nervosa, it's actually, out of all of the psychiatric diagnoses, anorexia nervosa has the highest rate of gray matter loss when it comes to like diagnostic. So for gray matter, if we see a decrease in it, we're going to see differences in how someone processes things neurologically, which then would also transfer into how someone processes things musically, which is really important if we're going to do music therapy. So while the gray matter loss is sort of spread across the brain, this is a good example where you can sort of see on the left side of your screen how there's that individual with acute anorexia versus a healthy control on the far right side of your screen. And you can sort of see how there's just more mass, more volume within the brain when you're looking at like that white. And then in the middle, you see someone who has been weight restored, but you can kind of see how it's kind of in between the two, how it doesn't necessarily look exactly equal to that healthy control of an individual who hasn't had anorexia. So using weight restoration to get a person back to a healthy weight for them is important, and it will restore some of that gray matter, but sometimes it's not always everything that once was. So the majority of studies that I looked at when I was synthesizing saw a lot of differences in like limbic areas or areas that were sort of connected to the limbic system, and some more frontal areas as well as parietal. So these are just a few examples of that, especially like cingulate cortex, frontal parietal, hippocampus, amygdala, and insula. And then here's just another visual that kind of gives you an idea, again, of they're all sort of in similar areas, but this particular study was noticing lots of differences in the thalamus, and then again, like in amygdala, hippocampus, those sort of areas. And so for the purposes of this, we're going to be looking mostly at the frontal parietal network, which is especially the posterior cingulate cortex as sort of part of that especially the PCC had a lot of gray matter loss as well. And then within the limbic system, we'll be looking at the hippocampus and the amygdala. And then we'll also look at the insula, which has some connections to the limbic system, and sort of relay some of that information, which is important for understanding our body, somatosensory, cortex to the limbic system, so like emotions and how we're experiencing things in our body and senses. So here's just a chart that kind of gives you a little more idea. This is not exclusive. There are a bunch more things that I could have put on here, but in the frontal parietal network, we see that it helps us in perceiving our body stimuli and our orientation and kind of that visual spatial processing. So we see some deficits in this with anorexia, which makes sense because there are some like body image disturbances. And then we also see, because of like that frontal area of our brain, we're going to see some in anorexia like cognitive inflexibility or difficulties with like inhibitory processing, things like that, because cognition is very much affected. And then when we're looking at the cingulate cortex, we see like some of the connections that the frontal parietal network has with the cingulate cortex is like the default mode network and some like the executive functions, things like that. So we really see that also play into some of those difficulties with things like cognition or understanding if we do an action and what our brain and bodies learn from that action. So some other differences, now moving more towards the limbic system, we have like the hippocampus. So there's in anorexia nervosa, we have a lot of like more anxiety that sort of comes up or some mood shifts, even things like some depression symptoms. So we see some increased negative mood and rumination. And then the amygdala is really important here as well, because the amygdala is the one that mediates the fear, anger, anxiety, those sort of emotions. But for example, when viewing food or if someone is hungry, they're going to have increased stress activation, which is a problem because if you're feeling really stressed around food, then you're not going to want to eat that food in the same capacity as maybe someone else. And then we also see again some more body image distress and their difficulties with emotion and processing those emotions. The insula is very important for understanding our internal cues of our body. And so for an individual with anorexia nervosa, we see kind of misinterpreting of some of these signals. So especially when it comes to things like hunger and fullness. So rather than recognizing, okay, I'm hungry right now, there's less of that ability to sort of differentiate and determine that, okay, I need to eat. So then there's less drive to eat. And then when there's less drive to eat, then food restriction also increases, which in turn also changes the insula more. So you can sort of see how it sort of kind of snowballs from there, which is really important. So how does this transfer over to how an individual with anorexia nervosa might process music? Well, we see some of these differences again with like things like cognitive flexibility. So that might be something that we might want to work on in music therapy, but we also don't see less creativity, which is interesting. So even if some of the things with music, like musical structure, that might be difficult, or like set shifting within music, but these individuals can still be quite creative. And then we also see some differences in like the cingulate cortex with kind of that connectivity to like frontal areas of the brain, and that can impair things like cognition. Then again, with like hippocampus, we see some of that more emotion stuff and memory things. And so with both the amygdala and the hippocampus, it's important to, as we're doing music, understand that these individuals might have a higher chance of ruminating on certain things or becoming more quickly activated. So we want to make sure that the music structure and elements are going to be most helpful for this particular population, and not being, just being mindful of that heightened sensitivity. Then for the insula, we see again some difficulty with like regulating emotions, and there might be those stronger emotional reactions. So once again, just kind of being mindful of all of those things. So something else I want to touch on here is that there are some differences that are probably neurological, and there's some that could also be developed. For example, if you diet, you have a higher chance of developing an eating disorder. then there's also like a high heritability for eating disorders because it's very multifactorial and very complex. And then things like environment or personal traits like perfectionism can also sort of contribute to developing an eating disorder. So we have some research that does show that there's substantial evidence for those neurological differences that is sort of something that someone is born with in some sense. And then through dieting and other things that can sort of increase some of these changes within the brain. And then we also know that food restriction itself does change brain structure. And so all of that in turn is going to increase some of these eating disorder symptoms that we see. That's why early intervention is important. So it's not just about weight. Even though we're talking about typical anorexia nervosa, which we would say the best protocol is to increase that weight to help that gray matter loss kind of restore. We see in atypical anorexia that there are similar symptoms, just not having that weight loss. So these differences could also apply potentially to both atypical and typical anorexia nervosa. And so we know that neuroplasticity is a thing, a beautiful thing that our brains do in recovering from injury or being able to recover things like gray matter. And so with music, we have research that shows that it can help increase this neuroplasticity. So if that is the case, we can see that music emotions can change activity in areas like the amygdala and the hippocampus, cingulate cortex, especially things like music evoked pleasure, for example. And music as a whole, if it can change things within these areas and we can use music to work through some of these things, it's going to be really beneficial for individuals with anorexia nervosa. So we see that the impact of music mechanisms on these sort of areas we're looking at, we see improved spatial learning with the hippocampus, reduced negative effect, which is important because in order to have self-efficacy for working on recovery, that's important. And then we also see some increased like functional connectivity between different areas of the brain and then help with that cognition piece as well. So there's a lot of impact on brain structures. And if we can see that music changes these brain structures, it's going to be especially beneficial for these individuals. We also know that there's some transdiagnostic things that are similar. So we see that neurologically, there's similarities in anorexia nervosa, as well as in depression, anxiety, PTSD, even schizophrenia, and also addiction, which makes sense because in a way, hunger is similar to if you were using a drug, which it seems kind of weird, but it is very similar with how it affects things like the reward system. So music therapy experiences have this efficacy, and we can see that for these conditions with similar areas of the brain affected, music therapy helps change the structures. So that has really big treatment implications for anorexia as well. So within music therapy specifically for anorexia, with the research that I looked at, we see that music therapy is able to help with the self-efficacy piece. So that's really important for being able to not only just be experiencing deep emotions that are more negative, but also understanding that a person can sort of access being able to, trying to think of what I'm trying to say, but like if someone has a lot of these depressive symptoms or if they're very anxious, being able to help them experience things like joy or what recovery might look like outside of their eating disorder and sort of separating pieces like that out. That's really important. Also with like group music therapy, there's some social connectedness and even individually one-on-one. Another one that I think is really important to highlight is that through music therapy, we know that we can decrease post-meal anxiety. So a lot of times eating provides a lot of stress for these individuals. So if we can reduce that discomfort or provide a way to sort of divert from what we're thinking about because of food that we just had, that can help in being able to digest the food better, and in having less stress, our bodies are going to be able to do what it needs to with that food, which then helps with things like weight gain as well. So we also see, again, when we're reducing that stress, then that promotes the weight gain, which then in turn, with more weight gain, more gray matter, we're reducing some of those eating disorder symptoms. And then music itself also helps to distract from negative thoughts and feelings through creativity, and then improves things such as mentalization and also body image, which is really important, and sense of self-worth as well. Music therapy has again been shown to assist in weight gain, which then increases gray matter, which is super important for repairing some of this neuronal damage. And we also see this as well in some other populations, such as individuals with Alzheimer's disease. We know that even when that's the gray matter is starting to like deteriorate more, that music can help sort of maintain or even increase some of that gray matter for those populations. And then we also see that with like older adults who are working on music making, and individuals who are engaging in music practice. And then again, you can see some of those same areas like the posterior cingulate cortex and the hippocampus and insula. So all of these other, even though these are different populations for this example on the slide, it still can kind of give us some idea of how, if it's really helpful for these populations with some of these similar things related to gray matter, then for anorexia, that should also probably be true as well. So the impact of specifically therapeutic music experiences are, these are some of the main ones that music therapists in general typically use. And so music listening can activate subcortical areas, which is important, as well as cortical areas of the brain. Music imagery is important for kind of that stress piece of letting stress and anxiety sort of go. And also we see more positive emotions rather than just negative ones. There's some empathy and shift taking that takes place with perspective. And then music assisted relaxation again is sort of similar in that it can help with stress and anxiety and providing coping mechanisms, awareness of our bodies, which is really important, and improvisation for self-exploration, self-expression, and also some distraction as well. So I know we have like 1 minute if anyone does have any questions. And if not, that's okay.
All right. Thank you so much, Megan.
All right, everybody. Thank you again for coming. My name is Sydney Winders. I use she, her pronouns. I am a Midwesterner through and through. I am currently a graduate student at the University of Missouri, Kansas City. I am almost finished. Amen to that. And I got my undergraduate degree at Drury University. So I came across this specific topic for my research at a time where I was asked to do an assignment for class. And I knew in my heart and my soul that I knew a little bit about cognitive behavioral therapy because that was the orientation of my education. But I think as a new professional and as an early graduate student, I really wanted to understand for myself and be able to communicate to my classmates and my colleagues what cognitive behavioral therapy is for our context. So what you'll see in this presentation that I have 13 minutes left for is we'll talk about what is cognitive behavioral music therapy. I'll give some lists of clientele that are appropriate for this approach. We'll look at applications and music therapy interventions. I'll show some documentation that could be written from a cognitive behavioral music therapy mindset, and then we'll look at personal influences, which is just sort of a large, sort of broad look at what are other cognitive behavioral music therapy or cognitive behavioral therapy entities sort of outside of our scope today. So really important to know that I hold respect for my education at Drury, at UMKC. I see my Iowa friends over there in the far right corner. I know that we are getting a really great education, but I do want to say and acknowledge that right now our education in the Midwest, my personal opinion, is sort of oriented around cognitive behavioral therapy, behaviorism, neurological music therapy. So when we think about the class that maybe we first experienced as an undergraduate or even a graduate level, it was like all the approaches, right? We talked about Robbins, we talked about behaviorism, we talked about creative music therapy, we talked about the Bonnie method. Cognitive behavioral therapy, although it's sort of our orientation and our educational reference point here in the Midwest, it is like a clinical approach, right? And so when we think about cognitive behavioral therapy, although it might be influencing our education and our clinical work, in the future, it is a very structured, very well defined framework for what cognitive behavioral therapy is. So this is what this presentation is essentially for. This information on the screen is taken from the Cognitive Behavioral Los Angeles. They give a variety of ways that cognitive behavioral therapy is described and used in therapy. And I pulled some of these quotes because I think they have a really good way of sort of describing the lens of what broadly cognitive behavioral therapy would look like. So cognitive behavioral therapy is a problem-solving therapy aimed to help you achieve your goals. This is a very sort of present idea of therapy. When we think about clientele, when we think about therapeutic setting, we're focusing on the present. Think about all those approaches in your past, your first like methods class, right? We think of like psychodynamic, Freud and all of his guy friends, thinking about the past, right? Your child self. This is the present as well. It's notable that cognitive behavioral therapy is active. So when we think about like the therapeutic setting, it's an active exchange, if you will, between the client or the group and the music therapist. It's really important to note also that cognitive behavioral therapy in music therapy and outside of music therapy is pretty well researched. So when we think about perhaps why we have sort of an orientation or a slant here in the Midwest and in other places to cognitive behavioral therapy in our education, it might have to do with the fact that it is pretty well researched. And that does provide us a lot of really good insight on the efficacy and the outcomes that go along with cognitive behavioral therapy. It's important to know when we think about all of these approaches and the orientations of music therapy and therapy broadly, we do sort of look at the client and the therapist and what the role is there. And so for my definition, and I'll explain it to you right now, the therapist is supposed to be supportive. So a supportive, collaborate thing as well. Lastly, for our little blue text box on the side, cognitive behavioral therapy, the nature of that framework is supposed to be brief. If we're talking about solving a problem, we are thinking about the problem, the solution, and then moving on in some sorts. I acknowledge and I respect that sometimes in our therapeutic work, that we sort of go from problem to problem to problem or whatever that may be. But the idea and the framework of cognitive behavioral therapy is that the portion that you're doing this CBT in is that it is a brief sort of section as well. My last quote from Los Angeles is that cognitive behavioral therapy helps you to learn and change your thoughts and feelings and behaviors so you feel better. That sort of informs our next slide here. So what is cognitive behavioral therapy? It's not just behaviorism. I'll talk about the difference a little bit later on, but that cognitive piece, when we think of therapy in a broad sense, I know I've said that so many times, but there is so much therapy. And as music therapists, we are trained and educated to recognize, right? All of the types of therapy. And so speaking and breaking down, I think cognitive behavioral therapy is sort of important in this context. So it's not just behaviorism. When we are thinking about cognitive behavioral therapy, we're thinking about cognitive, so thoughts, feelings, experiences, behavior, actions, patterns, etc. And then the therapy part is like addressing it, right? So when we speak on cognitive behavioral therapy, if someone were to ask me off the street, which probably would not happen, someone would not corner me and say, "Excuse me, Sydney Winters, what is cognitive behavioral therapy?" That only happens in my dreams, I guess. My answer would be cognitive behavioral therapy is a therapy in which you are identifying thoughts and feelings that contribute to maladaptive, dysfunctional, negative behavior, right? If something is not, if a thought or a feeling is positive or not a problem, you don't have to sit in your therapy and work through it and explain it. So in that definition, I would also note that our cognitive behavioral therapy has sort of a present orientation. When we speak on clientele a little bit later, I'll talk through why some therapeutic settings and why some clients might not be the perfect candidate for cognitive behavioral therapy for music therapy. And that is just simply because the client's ability or the client's experience or the client's scope is not able to recognize and understand the present moment cognitively. We have to think about the cognitive assessment when we are working in and out of this approach. Also, we're working towards adjusting the behavior through addressing the dysfunction. As a person, I don't really like the word dysfunction, but it's a quote, so I have to keep it on this screen. But the idea, again, is we are adjusting that behavior in our therapeutic work. And we are identifying those unhelpful thoughts or negative thoughts and feelings and changing it in some way. So I ask you to pause real quick and think about just like your current practicum setting or your current work, and think about like the easiest, I know that's relative, but like the most easiest or the closest goal that sort of comes to your mind, and think about if you're actually working or looking at or assessing or treating cognition and behavior. You might be, right? You might be thinking, yes, I am in a mental health setting and we are working on coping skills. That is a prime example of CBT in action. But maybe you are in a different setting. Maybe you're in a hospice setting. Maybe you're in a medical setting. Maybe you're in an in-home care setting, and you are doing a variety of music therapy. You're feeling very confident as a student or as a professional, whatever that may be. But take a quick moment, and are you actually addressing cognitive and behavioral goals? Are those things that you're thinking about as you move through your session? Those might be things that have been really educated to you, or things that you are really aware of as you move through the therapeutic space. But when we think about our approaches, when I have been asked sort of what is your orientation, my gut instinct is to say eclectic, and I would describe music therapy as a whole as a very eclectic field for our therapeutic orientation. But yeah, take a quick moment and think about, is what I'm working in actually cognitive behavioral therapy? Am I addressing sort of negative thoughts, negative feelings, and maladaptive behaviors? Okay, so the settings, that's a word that I like to use that is interchangeable with the word population. So where are we seeing cognitive behavioral therapy sort of manifest, sort of take place? This is really important because I just asked you that question, and maybe your answer was yes, maybe it wasn't. So who are the people that are served by cognitive behavioral therapy, and why is this important to note? Because we have to make sure that we are being ethical and all those important things, and well-rounded clinicians. So for our clientele, we will be working in mental health, people with neurological development. This could be an individual setting, a group setting, and most importantly, when we're looking at our clientele that are suitable for cognitive behavioral therapy, we are thinking about their ability to understand, think, and then bringing it back to what I said before on present orientation, they have to sort of have a level of reality orientation. we might not walk into a memory care setting and sit down and be ready for some cognitive behavioral music therapy. We know in our brains that that's probably not the most therapeutically appropriate way to sort of orient our clinical experience in that way. So clientele is a really key feature to this as well. It's not behaviorism, right? We're not just changing the behavior in a group setting, in an individual setting. We are really working on that cognitive piece, assessing if our client or our group has an understanding of their lived experience, of how it affects that behavior piece. And they also have to have a variety of ability to process or identify or acknowledge sort of social and emotional understanding as well. Application. What music therapist interventions are we using in our CBT sessions? Probably more than these, but these are the ones that are listed on this pink screen. Active or live music making or listening, progressive muscle relaxation, lyric analysis, songwriting, therapeutic drumming, therapeutic singing, much more. So the intervention in our clinical context can look like a variety of different things, a variety of different musical experiences, but we are, again, focusing on that cognitive piece, that behavioral piece. Briefly, I want to give you just an example. Let's be a music therapist for a quick moment. How about 30 seconds? So what are we doing in a therapeutic setting to sort of give an example of like cognitive behavioral therapy? So at the left top of the screen, you can see my goals. Let's say this is a group setting. I am facilitating lyric analysis. Let's say it's mental health. Let's say it's inpatient rehab, okay? Inpatient recovery. Our goals are listed at the top of the screen, and this is a songwriting or a lyric analysis of this song, I Won't Back Down by Tom Petty. So to address self-expression, to address opportunity for therapeutic breakthrough and identify coping skills, right? That's that cognitive piece. We would ask clients to do a lyric analysis of that'd be facilitated. And then the right side of your screen, this like light blue, is a songwriting with fill in the blank to the Tom Petty song. So I will stand my ground, I'll be, and then they'll put the action in there, right? I'll stand my ground is the cognitive piece. What are you doing? I'm gonna change that into sort of a positive thing. I'll be, and then the client would fill in there. Just a brief example of the use of our CBT as well. What might CBT documentation look like? It's casual, maybe narrow, maybe eclectic. There's a variety of ways that cognitive behavioral notes can be taken. But overall, there will be sort of an objective narrative. So you might say as evidenced by this. So I saw the client identify bad or maladaptive or dysfunctional thoughts and feelings as evidenced by saying that they don't like themselves or saying that they make wrong decisions or whatever. Documentation for cognitive behavioral therapy might sort of have an if-then statement, right? We're working on those behaviors, and so you might say if then something else. And you might use in your description of how the therapist interacted, again, I said like a supportive role, you might use like sort of phrases like when the therapist does blank, the client will blank when you are making your objectives, and those will address the goals, obviously. Looking in a broader context, what does cognitive behavioral therapy look like in other settings? I said it's well researched. In music therapy, there's a lot of publications on what cognitive behavioral therapy is with certain populations of certain settings. We see in our professional literature a lot of research in from AMTA, from the Journal for Music Therapy, from music therapy perspectives. We also see this orientation, like I've said earlier in my presentation, very well attuned to sort of our clinical education in the Midwest. So I think that's really important to acknowledge. If you want some resources on cognitive behavioral therapy, I'll leave my email in the chat and you're welcome to connect with me that way. But cognitive behavioral therapy does sort of exist as our default orientation in the Midwest, and it is a very well-researched method, orientation, approach for therapy. This is the time where I ask if you have any questions. I also want to acknowledge that our 15 minutes did pass, but I also want to thank you for your time today. For Passages, I'm really excited to see sort of what happens and where we go from there. Does anyone have any questions specific to my presentation today? Yeah.
Do you think you would have done this type of presentation or looked at this research if you hadn't been assigned it?
That's a brilliant question. No. So the nature of this class, just for some context, was that we're graduate students, first year graduate students. We're asked to sort of learn again or learn all of the approaches for music therapy. So each of my colleagues in the class did a presentation on an orientation, and I am that person that just kind of raises their hand willy-nilly. So I raised my hand for CBT and I was like, oh yeah, I'd love to maybe do this. I know that I was educated on this before, but I don't think I would have. But I'm really glad that I did. Here's why. My personal anecdote is just that as a new therapist, as like post CBMT, you get your credentials, you're headed into your new job, you are really looking at the application of all those skills. And when I was thinking about that time in my life and that part of my journey, I was really apt to identify where certain orientations, approaches, and where cognitive behavioral therapy and behaviorism specifically was manifesting in my clinical skills and my documentation and my orientation as well. So I'm grateful that I did, but no, I don't think I would have chose this. I could have done the body method. I could have done neurological music therapy. It was just by chance. Yeah.
I'm curious about this realization you came to that CBT is kind of like the default kind of box that our Midwest education falls into. I guess, can you speak a little bit to like how you came to that realization? Did you yourself come to that realization, or did like a colleague or a professional point it out to you? I guess just kind of like, and then maybe have you ever come into contact with another music therapist that was educated in a different region of the United States that was not their experience?
That's a great question, Tess. I do want to acknowledge and say as a disclaimer that is my realization. I also respect that this is a recording, so perhaps other people besides everyone in this beautiful Zoom room will hear that. So I really appreciate you asking that question. Here's why I think so. I've had a variety of friends and colleagues say similar things. When we think about AMTA at large, we are like, why is AMTA a thing? It's for accreditation of schools, research professionalism, right? And so in the Midwest, when we think about just our schools in general, so all of our schools in Missouri, Maryville, Drury, UMKC, sort of orient around research as a function. And so when we think about the people and the research that has come out of our educational spaces, it is sort of oriented around cognitive behavioral therapy, behavioralism. Sort of the nature of a lot of this comes from the idea that our current education, especially at UMKC, is informed by the biopsychosocial model. I'm sure that's something that you guys have heard in your classes before. So that idea is that our therapeutic context comes out of biological context. So like, is there an illness and how are we dealing with that? Psycho, so are we addressing those psychological needs, and that sort of manifests in our mental health care? And then social, are we addressing some of our social, our connective, our language and speech goals as well? So I'd love to talk with you more about that, but if we think about the nature of the research that has a great history in the Midwest, that is sort of what I came to the realization for. For your question about other regions, I think most of us, like I said earlier, music therapy is fairly eclectic, right? We think about people who have a variety of education and credentials and training and a plethora of different theoretical orientations. As a music therapist, that does exist and that does happen. I know a variety of therapists and students and teachers who are getting a different education just across the state. If we think about maybe the nature of a Maryville education to the UMKC education, it does differ as well. If we think about other orientations, we can go to sort of the East Coast and West Coast and go from there. But I definitely think, in my personal opinion, is that the Midwest does sort of have a slant, a default to cognitive behavioral therapy, behavioralism, and neurological music therapy. Thank you.
Good morning. Am I on? Is this right? Are we on? I guess there's no response because nobody. Are we live? Okay. Hi. Good morning. I'm Maggie Rodgers, and I'm a music therapist, which I've been saying now for 40 years. We're going to start out with a song, and it is audience participation as well. And I know you don't have to unmute or anything, but just sing. And I want you to go. Do 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 do. Try it. Do 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 do. Do 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 do. Keep going. Do 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 do. Don't worry about thing. I don't hear the do 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 do. Because every little thing's gonna be all right. Try it again. Here, go. Keep going. Don't worry, everybody, about a thing. Do do do. Cause every little thing is gonna be all right. Rise up this morning, smile with the rising sun. 3 little birds sitting by my doorstep, singing sweet songs, melodies pure and true, saying, here's my message to you. Baby, don't worry about a thing. Why? Because every little thing gonna be all right. Baby, don't worry about a thing. Because every little thing is gonna be all right. All right, take my word for it. It will be all right. Let me put this over here, because we might need it again. When life hands you lemons, make lemonade. Here's a bunch of lemons right here. I don't know if you can see those. Am I in the video? Oh, there I can see myself now. Okay, cool. And I've had some lemons. I was kind of, when they asked me to do this, I thought, what makes you think I have lemons in my life? But we all have lemons. I've had a 40-year career. Oh, I'm supposed to do this. Okay. I've worked in mental health. I started my internship there. I stayed home with my kids, and then I did preschool, and I did school age. And then when my kids went to middle school, they go, Mom, you can't come to school with us anymore to do music. So then I started working in day programs and doing private practice and nursing homes. I've done 19 years of VBS, Vacation Bible School, anywhere from 27 kids to 500 kids. I've led a handbell choir. I didn't even know what a handbell was. And they said, Maggie, we need somebody to direct the handbell. I went, okay. Done all these things. And I even took the handbell choir to Fort Leonard Wood for Special Olympics for the Arts. And I'm sure you probably never heard of those, but they actually do have those. I've always volunteered at the American Stroke Foundation and JCDS, and now I'm working in hospice. So what we're going to discuss today is this is what Brandon told me. Okay, these are the lemons. Navigating the challenges and obstacles as a student professional in the field. We're going to look at our peers. We're going to look at the imposter syndrome. We're going to look at personal struggles. I'm struggling to even find the lemon. And then life balance, life-work balance, and compassion. Okay. Let's start with the fears. Those are those things that make you panic. Okay. Those are those things that you go, oh my, how am I going to get through this? But you do. You do. And I just learned in the last session that I was attending that, what did it say? Everything is going to pass. All emotions pass. I thought that was a good idea. All emotions pass. So the fear might be, I open the back of my car and I go, oh my God, I forgot to put the guitar in the car today. And I think, oh my God, what am I going to do? But you get through it. You figure it out. And the Wi-Fi thing. Ugh, how to get Wi-Fi. I'd just rather use a cord. But then you forget your audio cord. And so what are you going to do? And then you say, Maggie, I did a donation where you, at this elementary school where they had an auction and you get to do a birthday party. And I thought, oh, we'll raise money for the PTA. And they say, okay, it'll be 5 kids. And they're 5-year-olds and there are going to be 6 of them. And you get there and there's 20 kids and they range in age from 6 months to 12 years of age. And you go, oh my God, what am I going to do? But you figure it out. And sometimes those fears turn into something more wonderful. I've gotten gigs. I call them gigs. They're music therapy contracts from people that move around. In the healthcare world, people move from place to place to place. So if you have a placement at one place, that people will leave and they'll go to another place and you'll get another one. Or somebody, this was just a couple of weeks ago, I was down at the levee down here in Westport, and the lady goes, Maggie Rodgers, not, oh, you're the guitar lady, or are you that lady that plays music? She said me by name, and I was like, whoa, what? But I sang with her mother at the end of life in hospice, and she remembered me, and it's been like 3 years ago. So that's pretty cool. And then sometimes you get your name in the paper, or your pictures in the paper, or it's on some website somewhere. They ask you to come talk to somebody and you go, wow, that's cool. So there's surprises too. Oh, and then there's this thing they talked to me about, imposter syndrome. I said to Brandon, what is that? He says, oh, that means that you're expected to do something that you're not really qualified to do. And I went, as long as we can sing, we're okay. And this is what we know. And as long as we can provide music in some fashion, that's what we're meant to do. So I always say, just do it. That's what Nike says. Just do it. It doesn't matter. Just do it. I'm volunteering at the shelter in Johnson County, and they've asked me for 150 songs in the last 3 weeks. And I just look at them, I go, dude, I'm not iTunes. What are you asking me for? You know, so just fake it till you make it. All right. And you, as a music therapist, are valid and you are enough. So don't ever let any negativity slip into your life. It doesn't do you a bit of good. I struggle with imposter syndrome was when they ask me to do this, or when they give me an award or something like that. I'm like, oh, I don't want to do that. But you have to come up with your own rules for that. We'll go on. Live music is best. Absolutely. But we cannot be iTunes or Spotify or whatever else. And that's why you just Google what you can and Spotify the rest or do whatever. But just, I tell them at the shelter, hey, I don't know that. I don't know that song, but if I'll look it up on my phone, I'll play it if you want to sing it. They go, oh, I don't want to sing. It's like, why are you making me sing a song? I don't know. So just tell them you're going to give it a gallon effort and you're going to try it. And you'd be surprised how forgiving everyone is. My professor at UMKC here, my alma mater, even though it was in a building over on Main that is now the Contemporary Museum of Art for the Kemper Museum, it was Dr. Shirley Bean. And we would get up to do our solfege and she would always say, be brave, be brave. And I was like, yes, when you try something new, just do what Shirley Bean said, Dr. Shirley Bean, be brave, just give it a gallant effort. Okay, the next thing, which we all have, is personal struggles. Want the next one? Yeah, there we go. More lemons. Personal struggles. You have them. We have them. some pass, some continue on, and some we just wish they would go away. Your to-do list may be your source of stress. Maybe don't write everything down. You got to do a lot. Skip some items or prioritize. I tried to do 2 things at once many times, and juggling my schedule. At the time, my kids struggled, their schedule, my husband's schedule, try to be a good parent in the meantime and feed them in the back of the car while you're driving to the dance studio, or you're trying to get from a gig and tell them, don't step on my guitar in the car when you get in, those kind of things. Or trying to find childcare while you're working. That's always been a struggle. Divorce. I put it in there, divorce, like the song does. And I've lost quite a few family members, my mom, my dad. I've had 4 brothers that have either died or been killed. And so I know what it's like to lose a loved one, and they leave a big old hole in your heart, and you try to go through that. I'll tell you a story. After I live here in Kansas City, and my brother lived in St. Louis, and he got hit by a car on a sunny Sunday afternoon and was killed instantly. And I truly think the angels grabbed him by the nape of the neck and ripped him into heaven before he ever knew what hit him. But I went to work the next day because he was in St. Louis and it was a police thing. And so there wasn't going to be a hurry up funeral or anything like that. And so I just went to work, and nobody knew that my brother had died. And I go into this one of my patients for hospice, and she forgets her daughter's name. She forgets where she is. She forgets everything. And 2 weeks before that, when I went in to see her, she said, you know, when we're done here, I'm going to call my mom. I'm thinking to myself as a music therapist while I'm smiling, going, lady, I don't know what kind of phone you got, but I don't know if you're going to be able to call your mom, because she was 97 years old. And I said, well, I wish I could call my mom and dad. But I said, they're both passed away. And so I see her the day after my brother died. And she says to me, when I first came in, she goes, I remember you telling me that your mom and dad are both gone. And I said, yeah. And she looked straight at me in the eye and says, how's your brother? And I was taken aback for a little while, but you know, we practiced that face and to just keep it together. And I said, he's fine, just like that. And I wanted to say, are you seeing him? Is he here? Is he here with mom and pop too? I don't know. But it gave me comfort for her to say that. And I truly think sometimes in hospice, there's a thin veil between this and the next place we go, whatever you call it. And she was halfway there and halfway here on earth and vacillating back and forth. So I don't doubt if she saw my brother, and I thought that was pretty cool. It gave me comfort. So there's a lot of things in our lives that are lemons, but maybe you can make some lemonade out of them too. I got diagnosed with multiple sclerosis, I think about 8 years ago. I did some gardening, I got scraped, and the next thing I know, the next day I had, this was Mother's Day, so it was in May. I couldn't walk right. I was having a fever and diarrhea. I didn't know what was going on. And so I started working, but as the time went on, my hand was like in a claw all the time. I couldn't move it. I had a lot of nerve pain in my arm, and that's my strumming arm. And so I kept working. I couldn't walk right. I had a lesion in my spine between C5 and C7. So it went from my right arm, and that's where it crosses down into my left leg. And so I'd be just walking along, and all of a sudden it felt like I was walking in a hole because the signals from my brain couldn't get to my leg because of that lesion that was pressure in my spine to expand in that part. but I continued to work. And so we as music therapists know how to adapt things. So I got a thumb pick and I held onto the thumb pick and I was able to strum and continue to do it. I didn't move around as much as I used to because I was afraid I was going to either impale me or impale the people I was working with. So I kind of learned how to sit and stand still for a little while. And it probably took me until December. So from May to December, that's 7 months to begin to function again. I still have trouble with snapping my fingers after that incident, but if you do both at the same time, nobody knows how weak your snap is because you got double the sound. I was also at the Jewish Community Center when the mass shooting occurred. I had just walked in and saw, I said, oh, I forgot my guitar in the car. I'm going to go out. I forgot my phone in the car. I went out and that's when I heard the shots in the very next parking lot. And when I went in, it was for the auditions and I saw that somebody had a guitar in the corner that they were going to audition for the Kansas City Superstar with the guitar. So I go in after the whole place is shut down within moments. I'm hearing the shots in the next parking lot as I'm stopping this man whose window was shot out from the shooter that had just missed him. I go in there and they have all the people that were there for the auditions. They had a camp for kids with autism. And then they also had a dance group that was meeting in there and we were all in this one big room. So as a music therapist, what do? You think, I saw a guitar. Where's that guitar? So I asked the kid for the guitar that he brought it, and I started strumming. And I sat down with the kids that were in were there for the camp for the autism, and I sang "Let There Be Peace on Earth." And my friend who's Jewish, I noticed that she wasn't singing. So I sing, and then I say to the kids, "What do you want to sing?" And we did "Baba Black Sheep," I don't know, about 5 times or so. And then I went over and then they started doing it themselves, the leaders of that camp, which were really a lot of adolescent kids. They weren't trained professionals at all. They were just volunteers that were there. And I went over to my friend, I go, so is "Let There Be Peace on Earth" a Gentile song? What's the story here? And she said, no, Maggie, we're just in such shock. We couldn't sing. But we as music therapists, we do what we need to do to fill the gap. So that's a lemonade kind of a moment. So whenever you get in a personal struggle like that, trust your basics, go to your tools, use that isomotic principle, start where people are and validate where they are and take them to where you want to go. I use that throughout life, whether it's music, whether it's just talking to people, and see the people for who they are. Look at them, look into their soul, and don't just see, that their clothes are disheveled or they haven't showered and you can smell them from 5 feet away. Try to see the good in people. Try to see the good in people. We're all made in this world to survive together. And then people try to put you in a box. Stay out of the box. I don't even know if there is a box. But people will surprise you. Just as soon as you put them in a box, they'll surprise you. When you look deeper, they're just another person like you. They're just trying to struggle and get along and get through life's little speed bumps. And the boundaries are dynamic. So you think people are in this box, and then all of a sudden they surprise you and they're just like way out of the box. And people can change. And if we didn't believe that, we would not be music therapists, because we believe that we can make a difference and they can change and they can process better, live better, and maybe even play the guitar or sing better too, depending on what your thing is. So next, life, work, balance, okay? Life, work, balance. Isn't that funny how that clock got in there? I thought that was funky. And I better look at the clock now. We have till when? 10? No. 10. Yeah, okay, we got plenty of time. Does anybody have any questions so far? Have you seen anything in the chat? Okay, cool. Be sure to ask questions if you want to. I'm gonna take a little sip. Okay, life-work balance. God knows, sometimes you're playing a gig and you miss your kids' performance, or I think I've done that a couple of times. And you just have to say, okay, I can't do this and that at the same time if you can't reschedule around. Hang in there, keep things in perspective. I put a light bulb there so that you get better ideas about how to work around a problem you might have. But you are your own worst critic. I have a friend who they would always say, oh, I get nervous at parties because I'm afraid everybody's thinking this of me or thinking that of me. I go, dude, nobody's thinking about you. They're all thinking about themselves. And then they might think of you later, but everybody is thinking about themselves. And so quit worrying about that. When you play something, you make a mistake. I made a mistake in Three Little Birds, but we just keep going. And sometimes my face will go, whoa, where did that come from? But just think about the positives. I played in a band for 15 years and we would play, 60 songs in a night. And the people that I played in the band with did not do music by day. They only did music at night. And it was very, how do I say, is it right brain? Right, very, very organized, very always exactly the same every time. No give and take, no nothing. And they would say, well, that lick on something you messed up. And it's like, I played like 15,000 right chords and you're going to pick out the one that I didn't get right. Give yourself a break. And we used to say in mental health, three strokes for every poke. So name 3 things you did right before you can pick on yourself for one thing. And I know as students, you're trying to better yourselves and but we're human. It's okay. You'll get it all. It'll be fine. And then try something new and creative. I went to a place called Dreamsworks and I co-treated with a belly dancer for about 7 years. And you go, what? And if you've ever gone to Tasso's, you know Zaina Ali, and she's the belly dancer I work with every Wednesday afternoon for many, many years. And she would bring the belly dance music from recording and people that were like this in their chairs. They were multiply disabled people, and they had calluses on their knuckles and in their hands from squeezing like this. And then you put on that music, and we had scarves, and they're more like tablecloths, not those little 12 by 12s that West Music sells, but they were huge, like tablecloths, big things you whip around. And they would, next thing you know, they'd be playing a kabasa, their hand would open, they would sway back and forth, and the music just opened them up, so to speak. And I had a paddle drum that was about, it's probably like 3 feet in diameter. And I brought it, and we had massagers that you get now. I don't know if they have them all the time, but they're the little hand massagers that have like 4 little knobbies on them, and they're battery operated, and we could put them on people and put them on their back. And I took that big drum and we would put them on underneath it, and some of them lit up, and it was just like how much they would reach out on that paddle drum to just reach out and feel that vibration on the drum. It was awesome. It was so great. And we would look at each other and go, we've been here for years. Why didn't we think of this before? And so we try new things all the time. Have you ever heard of an octaband? Anybody hear of an octaband? It's, if you go on the website, I think my review is on there, but it's a circle made out of like swimming suit material, stretchy. And it has 8 big things coming out that's also made out of swimming suit material. And then there's a sewed loop at the end. So you could put it on people's wrist. And we actually used it like a slingshot. So we would put the big circle behind their back, and then we would take the arms, and people in wheelchairs get pushed and put places and move places, but they never feel that on their body. So rather than put it on the back of the chair, we put it on their person so they could feel that resistance. And we use 4 of the things on, I should have brought it with me, 4 of the arms. It had octa, so it's 8. And I would take 4 of them and I would put it behind them, and then I would put them either in their wheelchair, or if they were mobile people, we would gate belt them into a rolling desk chair, which is totally crazy. But we would put it on there, and then I'd push them back, run with them. And then when they started to push backwards, I would hold on to the octaband, and they could feel that on their body. And they just, I never heard so many belly laughs. And we would just do that. And of course, it's music therapy, so you do it with the phrases of the music. You use the scarves to go over their body, you know, when the phrases the music were in belly dancing and in regular dance, they always count in 8. So it's always an 8 count. But it was just fabulous. And we just tried new things all the time. Now that my kids are grown, and I bought a house, and now I'm into gardening, and I love gardening, and I just like digging in the dirt, and I think it's very healthy. I had a massage therapist tell me when I was having all the MS trouble, and she said, Maggie, I want you to go outside in the wet grass with your bare feet. And when the grass gets hot, move to a new spot. And I went, that sounds pretty crazy, but I'm going to try it. And being with the earth helps us. So get outside, do something. When you only have 10 minutes, be outside, do something that's natural. And then there's always that breathing part that we kind of skip out on sometimes. And if it gets really bad in your place of work, change jobs. Just change jobs. I remember I would go to 25 places a month, nursing homes, day programs, what you call preschool, in-home preschools, where I did music therapy. And this one place I went, and I would just, I'm pretty energetic, and I can energize a room in a few minutes, but this place, it would just drain me. I don't know if it was the feng shui. I don't know if it was just the negativity in the room. And finally, I just said, I can't come here anymore. It wasn't good for my psyche. And so I thought there'll be another gig. That's okay. I've had places that said, Maggie, all the people that come to our place, some of them are in the hospital, and we have to save the place for them, but we're not getting any income while they're in the hospital from their special services. And I said, okay. She goes, so we have to cut out music therapy. I mean, they tell me on a Wednesday, and next Wednesday I'm going to be gone. And they go, we're going to cut you out for the next month. And I just go, what are you talking about? And so by Friday, I had that slot filled with other places. And then they called us back and they go, we made a huge mistake. We should have canceled somebody else, but we need you to come for music therapy. I said, well, I'll see you in a month, because you told me to come back in a month, but I already got things scheduled. And so then they understand what happens when you're not there. So that's okay. I've worked for free. I volunteer. I try not to work for free where people could possibly afford me. but I think it's important to give music to everybody. And you got to see their side of the coin. If they're a volunteer kind of a place like the American Stroke Foundation, and there's only like 3 people that get paid to be there, the rest is all volunteer. I wouldn't ask for them. Plus, I've learned more. It's almost like taking a class. I've learned more in my volunteer work than I could ever learn by taking a class or reading a book. So take your music somewhere else. Let someone else play your guitar. It's really cool to see someone else playing your guitar. And you just go, wow, did you leave me any notes in there when you used them all up or what? And they always say, no, I'll leave you some notes in there, Maggie, and play anywhere. My daughter just shakes her head. She's 30 and she just shakes her head because I remember going to Nebraska Furniture Mart one time, and we were picking up something to put in the back of my little car, and I had to get the guitar out. And you know, if you carry a guitar, people are going to ask you, the first question you're going to say, you play that thing? No, I just like to carry it around because it's cool. You know, I got my clothes in there. No, yeah, I play the guitar. That's why I carry it around. And so they always say, well, can you play us something? And I played at the Nebraska Furniture Mart pickup drive-through. I played at the dealership when I dropped my car off for service and I had to get my guitar out and they didn't know who I was. And I said, yeah, I'll play for you. And they even vouched for me one time. They said, Maggie, oh, you can't charge her for that. She comes in here and plays her guitar for us. And I was like, yay, give me a discount. I'm all for that. So you can, and then there's the compassion lemon. This is the last lemon that I was told to talk about. And can you tell I like music? I believe in music. And it's not just about the song. It's about the effects that it has on everyone. It is straight up from nature, science, God, whatever you call it. Working in hospice has taught me that when you have music, it is truly mimicking what is in nature. So we have 3 little birds. I got 3 little birds on my shirt. I even got this shirt specifically for this gig. It's got 3 little birds on it. And we try to make it sound like things in nature. We mimic nature in our music. We try to get it to sound like rain. We try to get it to sound like thunder. We have, you know, marching music. We have shuffle music. We have that. Those are people walking with a walker. So we have all those rhythms and all those sounds that we mimic nature, and it stimulates us physically. Our heart's entrained to it, and we have the chemical part where our brains are releasing those chemicals, and they will do that until we take our last breath. And then emotionally, you got the music, how it stimulates you emotionally. And then you got the spiritual aspect of the music. And so now that I'm working in hospice and at the end of life, when the physical is shutting down and the chemical is shutting down or it's way slowed, and the emotional, I thought it might be there, but we can't see it. And the spiritual connects us right back from whence we came, however you got here, whether you think it's science, whether you think it's nature, whether you think it's God or some other supreme being. That's the way it is. I went in a hospice patient's room on a Tuesday after Memorial Day, and she didn't have children, she wasn't married, and her church family was everything to her, and they were there around the clock through the whole Memorial Day weekend. And our nurse said, she's nearing the end. And I said, I'll come right away. So I started singing with her about 8:40, I think, until around 9:30 or 9:20 or so. And then her friends were leaving and the pastor from her church came. And I said to him, I said, music, this is when I first thought of this. And I said, it stimulates us physically and chemically and spiritually and emotionally. And I said, when all these are shutting down at the end, emotionally, it might be there, but we might not be able to see it. And the spiritual connects us right back to God. And he just looked at me with this glaze over look like, what is this lady talking about? So he sat down and I sing this lady. I sit down at the bedside and I'm this close to her. I'm like 10 inches from her face. And I start singing and she's got the breathing going on, open mouth breathing. Her eyes have been closed for 4 days. And I start singing Just a Closer Walk with Thee. Just a closer walk with thee. I'm playing the guitar. She opens her eye. She looks straight at me. And I'm starting to go, whoa, this stuff really works. I've never ceased to amaze myself at how music still gets to people. And then with her open mouth breathing, she's looking at me and she starts to bare all of her upper teeth like that. And I just looked at her and I went, you get it. She was smiling at me and showing me that the emotion is still there. And in the second verse, she passed away. And tears running down my face, and the nurse, and the preacher. And I said to the nurse, that was amazing. And she said, Maggie, when you sat down with her, her oxygen levels were at 72%. And when you started singing that song, they went up to 88%. And she said, I was listening to her heart, and her heart just started to slow. The rhythm just slowed until it stopped. And I thought, wow, we have validation. Here's a medical person that has measured this and was observing this. And that's what music therapy is about. It's the coolest thing ever. So how do you keep fresh? Try a new song in a new place. I work at a nursing home, and sometimes I'll sing little kids' songs that they learned, a nursery rhyme or something, and you'd be surprised how well they know it, even after 98 years and memory issues and everything else. I say, try a new place. I sing at the Salvation Army on Christmas and Christmas and Thanksgiving, and I sing outside, and it's a totally new place. Or I sing at the shelter, but people, it's wonderful. You never know what you might experience, and you get more experience when you keep putting yourself into those kind of places. Go to a conference outside in MT World. Yes, I just went to the stroke conference at the American Stroke Foundation and heard a neurointerventionalist and a PT and a speech language pathologist, and it was awesome. It was a really, really good day. Listen to the music of your life that surrounds you. That's for sure. There's music all around us. And I say, take a walk anywhere, in the woods, on the street. Take your earbuds out and skip the podcast and listen to the birds and listen to the people, the leaves crunching under your feet, or people tripping over the sidewalk, or the bicyclist that's coming by you. Listen to those sounds. That is the symphony of life, and it will make you feel better. And stay fresh. Here's some, I don't know what that is. I don't know, some kind of lettuce thing. I don't know. But continue to educate yourself. Take a class, read a book. I like listening to people's stories about their life. And they'll say, 2 months there, I said, oh, you told me about this. And they go, you remember that? I go, oh yeah, I remember it. We're musicians. We listen to things and we remember. That's how we memorize our music. So that is our skill. Use that, utilize that, and quit focusing on the struggle and just focus on the outcome. Maybe you didn't play that song perfectly, but the people still smiled and they still sang along with you. And I've been with people that said they were totally like this, closed eyes, hands in their lap, look like they're non-responsive. And when I say, I sing a song and I screw up the second verse and I mix the second verse lines up with the third verse lines and vice versa. And at the end I said, oh, I think I mixed up those lines. And she opened her eyes and she looked at me and she goes, you did. That's awesome. That means they're paying attention. So that's exactly. I had a friend who told me that he wanted to, don't do things for the view of it. Don't just do it because it's going to look good on your resume. Do it because you want to do it. It'll be good on your resume. Maybe you won't even tell anybody about it, but just do things that you think are right and that people need music. Go there. Go there. If you're making a difference, you're doing it right. And you see a change in people, you know you're doing it right. I was with a clergy member and he said, you know, it would be really good for me to go with the sisters on the street down on Independence Avenue because people driving by would think, oh, there's a clergyman there on the street helping the homeless. And I went, is that why you want to go? That's not a good place. You should go because these people need you and they can benefit from something you offer. Not because it's going to look good for people driving by or the people walking by. Just be in the moment. Here's an example of being in the moment. Think about where you are and what you're doing. I remember going several years ago, we were taking a trip to the Carolinas and we were going to the beach. And people said, are you going to South Carolina or North Carolina? I said, I don't know. I ain't going today. I'm thinking about today. But when I get close to Carolina, I'll either make a right or a left, depending on where I'm going. It's like, why do we worry about stuff that we don't need to worry about? Push it off. Let it go. It'll be there tomorrow. And if you're thinking about something that's going to happen on Friday, and like my brother was killed, he would be worried about something that was going to happen that he didn't even get to live through. So I just take every moment and say, yep, let's live right now, right here, right now. And that's good. And then when you're thinking about the music, sometimes that's too much. Just play, enjoy the music yourself. And they will too. Somebody told me one time, she was an opera singer. She said, Maggie, if you can't make the hair on the back of your own neck stand up, how are you going to make anybody else's stand up on the back of their neck? And I went, that's a good point. So sing like you're trying to make your own hairs on the back of your neck stand up, and you'll make a huge difference in the people that are in front of you, or maybe the people that are behind you too, because you know we always circle when we're doing music therapy. During the pandemic, I played on my porch and just wrote on the sidewalk, porch concert. People brought lawn chairs and just played on the porch because I wasn't playing with people except online or in full PPE where there's so much between you and them. Play in the park. I invite you, if you're in Kansas City area, that on April 12th, the shelter will be closed. And they love the music so much. I said, let's meet in downtown Overland Park at 5 o'clock, Friday, April the 12th, and we'll make music down there in the park. And they go, yeah, because they go, this is really good, but the shelter closes on April 1st. What are we going to do after that? I go, okay, let's do April 12th. And so that's what we're doing. And that is something new that the shelter has done, trying to create that community that we already have going at the shelter and bring it somewhere else. So that's good. I sometimes, the lemon that comes into your life is a good thing. Is it time to make lemonade? I have lemonade, right? It's good. I currently supervise a music therapy student whose last name is Lemon, and you might even know her. It's Kelsey Lemon. Isn't it great? So when life gives you lemons, make music therapy. It's just perfect to do. Oh my goodness. I'm wondering if there's any questions out. Oh my gosh, what did I do? Did I do that? Okay. I'm really horrible at technology. But I thank God for Brandon Thibodeau, who helped me do this today. Otherwise, without him, I wouldn't have been able to do this. Does anybody have any questions, any comments, any suggestions? There's a lot of stuff. Is that the chat? Am I supposed to be paying attention to that? I don't know how to do it. I don't, huh? Does anybody have any questions? You can unmute yourself and just ask.
We have 4 questions from CSU, if you don't mind answering those.
Yeah, absolutely. Depends on what they are.
Alright.
If you're asking me how to get somewhere, I have no idea about directions.
I
very
don't think those are any of ours, so I think you're good. What first got you into music therapy?
High school, gym class, and they were singing the song. I know this is way old because it was back in the 70s. And our gym teacher was playing the song, "Go, you chicken fat, go away. Go, you chicken fat, go." And we were all jumping rope. And I thought, man, if you got the right song, you can get people to do just about anything. And so I didn't know about music therapy, didn't know where it was. And that was before the internet. And so I went to Harris Teachers College, which is now Harris Stowe, and then became Harris Stowe State College, and wanted to be a music educator. And I was walking by a sign about Maryville University, although it was Maryville College at the time. And it said music therapy. And I went, So I went to this place called the, I can't remember what it's called, but it was like a office you could go to, and they had this old dot matrix printer, and the guy, it was like the first of the internet, and he put in music therapy, and he gave me a printout and said, there's 47 colleges in the United States that offer music therapy, and two were in Missouri, and one were in Kansas. And there was nothing in Illinois at the time. So I could either go to Maryville, or I could go to UMKC, or I could go to KU. Well, I was from St. Louis, and I wanted to go to UMKC because Dr. Wanda Latham, who was the president of American Music Therapy Association, was the professor here, and I wanted to come here under her guise. And so that's what got me into music therapy. But I didn't know anything when I got into music therapy. I didn't know what a circle of fifths was. I didn't know any of that stuff because I didn't have any of that background growing up. I took piano lessons when I was in the 2nd grade, and when they were $2 and they were going to go up to $2.25 for a half an hour. My mom goes, okay, that's all the lessons. But my 8th grade teacher said, if you have a guitar, I'll give you a free guitar lesson, but you have to play at church. And so I always tell people, go play at church when you're practicing and getting up on your skills. And they go, why is that? And I said, because every week you have to learn a different song, and it'll push you where your teacher might give you the same song for a month. So, okay, next question.
If you have an inspiration in the field, who is it and why?
Who's my inspiration in the field? My internship person was Lorraine Peary Long, and I worked with her at Western Missouri Mental Health Center, which is now part of the University of Health System. And the other person is Andrea Dalton. She's amazing. She's amazing. I swear that woman doesn't sleep. Do you know who she is? You should. She's a current music therapist. Yeah. Anybody else?
Yeah, there's a question in the chat. I can read it if you'd like, or if Brandon has it.
I can read it.
Please. I don't know how to do it.
So Sydney asks, do you have any advice for new professionals entering the workforce?
Yes. My friend Allison Eberts, who is now not a music therapist anymore, she was a practicing music therapist. She would say, don't prostitute yourself. So don't take less money than you think you should get. And you can call AMTA. We talked about this yesterday at a CMTE about ethics, is that you can call AMTA and you can get the current going price for an hour of music therapy in your area, and don't undersell yourself. And when people say, like, they'll go, well, if you come for free the first time, we'll pay you the second time. You know your skills. Don't do that. At first, I used to think I had to do that. But no, you don't have to do that. You say, no, I'll tell you what. And I went into a place one time and I said, they go, we don't know if we want music therapy. I said, I'll come in for 6 weeks. This is what you'll pay me. You can give me 6 clients, 6 residents, and they'll pick out the worst because that's how they work. And say at the end of the 6 weeks, you can tell me if you want to keep me or not. And that way you go in there and you know what you're going up against, and it's for a limited time, and you can find out what the vibe is in the place. And maybe you don't want to work there. Maybe the people are nasty, not the residents, but the staff. And if staff are bad, there'll be other places you can go. Don't get discouraged. Like I said, and people said, oh, do you have a website people can go on? No, I never had a website. But it was word of mouth. Get a business card, hand it out, and give it to people, and they'll know who you are. And a lot of people know who you are, and you don't know who they are. Like, I'm singing with 500 kids at Bible school. You know, a lot of those kids, I don't know the names. I mean, sometimes their name tags are on the back because they're too little because they keep peeling off. But the parents know who you are, and they see you, and the kids grow up and they work in restaurants and they go, you're Miss Maggie. And you go, oh my God, I haven't seen you in 10 years, you know, and now they're all grown up. So don't let people tell you that nobody's going to know what you're doing or how you're doing it. And I was never one of those people that said, oh, that's entertainment money. It should be music therapy money. Honey, however you pay me is cool. I got to pay the light bill. And I went into schools where they have a budget for like for young audiences to come in or things like that. And they paid me out of that budget. So think out of the box, stay out of the box. Don't even know where the box is. Anybody else have a question? Those were good questions. I hope I made sense. Hope you got something out of it. If anything, have a glass of lemonade. It's great. Okay, how we doing? We got 2 more minutes. No more questions? Out singing what I used to sing. Let's see what Kale doing here. Come up here. Let's try it here. I'm a music therapist. I sing and play guitar. I work with different people. I get there in my car. I reach all folks with music, regardless of their choice, with guitar and instruments, and of course, my voice. Let's do 3 Little Birds again. Can we do that? Were you doing the do, 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 do? Do, 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 do. Now this time, instead of do, do, do the la, 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 la. Oh, did I do something I shouldn't have done? I don't know how to do that. Okay. Da, da, da. Oh, let's do this. La, 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 la. La, 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 la. La, 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 la. La, 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 la. Don't worry about a thing. I hear the la-las. That's great. Because every little thing is gonna be all right. Now don't worry about a thing. But every little thing is gonna be all right. Woke up this morning, look at the rising sun. 3 little birds sitting on my doorstep. singing, melody strong and true, saying, this is my message to you. Everybody, baby, don't worry about a thing, la 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 la, cause every little thing's gonna be all right, la 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 la. Don't worry about a thing, don't do it, no, cause every little thing is gonna be all right. Everything passes. Every emotion will pass. Don't give up. Be brave. Be brave. Dr. Bean said it herself. Thank you all very much. I appreciate you all. This was great. Thanks for the opportunity. Thanks for the honor.
Okay, so for this next session, we will be having a new professional panel, the ins and outs of a new MTBC. So feel free as we kind of go along to send any questions that you have into the chat. But additionally, we'll have a Slido here. So if you want your question to be anonymous, you can join this Slido, submit any questions that you have to that QR code, or go to slido.com and stick in that link. So feel free to send questions there. But we'll have our panelists go ahead and introduce themselves. I'll leave this up for just a couple of seconds, and then we'll get started. Grace, would you mind introducing yourself first? Sure. If you can tell us your name, pronouns, how long you've been a music therapist, and where you are currently working or have worked in the past.
Absolutely. So my name's Grace, she, her pronouns. I have been a board certified music therapist for a year and a half-ish. I currently work at a psychiatric center in behavioral health, and I also do private clients in home.
Thanks, Grace. And Haile.
Hi, good morning, everybody. My name is Haile Moy. My pronouns are she, her. I currently work at a inpatient mental health hospital. It's longer term for folks with severe and persistent mental illness. We also just opened up a couple new units to work with folks who have been incarcerated but need treatment before they can meaningfully participate in their own legal proceedings and trial. I have previously worked at a short-term acute mental health hospital and providing in-home music therapy sessions to folks with disabilities and other medical needs.
Maggie.
Hi, everybody. My name is Maggie Calabrese. My pronouns are she, her. I'm currently working as an elementary paraprofessional and doing some MT work on the side. I've been in MTBC for a little over 3 years now, and the majority of that was in hospice and bereavement, but I decided to kind of make a switch to doing part-time MT and part-time some other stuff just to have like a better balance. So we're kind of navigating that now.
Rachel.
Hi, my name is Rachel. I use she, her pronouns. I've been at MTBC for about 2 months. Hi, CSU friends. And I work at an acute inpatient psychiatric hospital, which is the same hospital I did my internship at. So it's pretty normally the average stays between a week and 2 weeks, but we do have some more longer term units and longer term patients, and there's about 200 beds, and I go to about 5 of the units 3 times a week.
And then I'll be the final panelist today. My name is Naomi Davis. I use she, her pronouns, and I've also been a music therapist a little over 3 years. I worked for a private practice in Maryland for a year and a half, primarily providing IEP music therapy services in the schools, and then in clinic services. I currently work for another private practice for another week or so, providing in-school music therapy services, hospice, memory care, and telehealth. And I started a new position working for an SLP practice a couple of weeks ago. And so that's all telehealth music therapy services with kids 3 to 18. So kind of all over the place, but have mostly worked in private practices since I started working practice. Okay, so we have already gotten lots of questions in the Slido, and y'all can feel free to, again, drop them in the chat as well, but I'll just go through these. And one of the first questions we got was, what was the interview process like? I'll maybe start with this one. I think the interview process looks vastly different depending on who you are interviewing for. I've interviewed for like music therapists in the private practice. I've interviewed for like in front of school principals, and most recently an SLP. So when I interviewed for music therapists or for a music therapy company, it was actually a 2-interview process. One of the interviews was a music interview. The second interview was, or the first interview was like just a regular interview where I talked about my strengths as a person, as a worker, and some of my experiences in music therapy. And then the second interview in that process was an hour of music. So they gave me like different scenarios and asked how I would manipulate the music in X amount of situations. They had me play a few songs. When I've interviewed for non-music therapists, the interviews have been brief and have never asked me a single question about music therapy. Like they just ask questions about how I would navigate working on a team and, you know, basic interview questions that you might find in like a summer job even. So it just depends. But I wonder if anybody else has some comment.
Yeah, I've had similar experiences to you, Naomi, where when I was interviewing with music therapists, it was definitely more music therapy focused, asked a little questions that got into more depth of what I do in my practice, what approaches or frameworks I'm most aligned with. My current position, I work at a state mental health hospital. The interviewing panel was multiple different people with different specializations, and it was kind of a mix of both, where they were asking like how you work on a team, but then they also had me provide like an example of a music therapy intervention. So I would say it's helpful to know at least a little bit about the people who like are interviewing you, what their profession is and what they do. So you can think about maybe relating some of your experiences and how you might interact with the team to what they do, as well as just really knowing yourself as a clinician. I forgot to say I have been a music therapist for 3 years to this day.
To add on to what Haile said, I think like you want to know as much as you can about who is interviewing you, which a lot of times is not a lot. But I would just say be ready for anything kind of. I had HR set up an interview one time and they didn't mention anything about music, anything about if I would need to demonstrate things. And I just kind of had that intuition of like, oh, okay, I should probably have my guitar next to me. So I did. And the panel asked for an entrainment example and several songs. So I was really glad that I had kind of thought about it in the before. So definitely just kind of consider like who knows what and what are they probably going to ask for versus who's scheduling me and what are they going to ask for.
Grace, do you have something, or Rachel, do you have anything to add to that? Or? Okay, cool. Well, we'll move on to the next question. And this one is, I think more towards Rachel, but how do you balance or take care of your own mental health while working in mental health setting? Oh, and also Haile, such as inpatient.
Yeah, I'm really fortunate to my hospital has had a creative arts department that's been established, very like well established for about 20 years. So we have a really, good team, and not only is self-care kind of like built into the day, like there's like a relaxation room with like a massage chair that's right down the hall, and then there's like always people around that have had the same experiences as you, so you can sort of like just escape with someone who gets it, which I think is really important, rather than having to like go home and talk to people who think that what you're doing is crazy. I think a lot of people cannot believe that I work at a psychiatric hospital voluntarily. So I think it's nice to, be able to talk to people that get it, so you don't have to keep explaining yourself. But otherwise, I would say the biggest advice that I got during my internship, and that I, continue to get as a new clinician is, and Haile can probably agree, is don't take anything personally. Try not to take anything personally. These patients, especially in the acute inpatient setting, they're coming in at a moment of crisis. Often they're brought by police, or they're brought by their neighbors, or they're brought, I would say probably 75% of the patients are there involuntarily. So you might be catching them on their worst day. So no matter what, just try not to take things personally. And I know that's easier said than done, but I think like, again, having that team to go back to, and they probably know that that patient's also having a hard day if we share units. But I think that's the biggest piece of advice that I can say to keep your mental health as healthy as it can be. And I know it's hard, but.
Yeah. Haile, do you have anything to add to that?
Yeah,
I have
sure.
something.
Oh, go ahead, Grace.
I also work in mental health. I work at a inpatient psychiatric center with adolescents to adults, all the way up to seniors. And I think it's really important to know your boundaries in that space as well, and communicate that with your manager. Things that maybe you aren't comfortable with, or if something does happen that makes you uncomfortable, be transparent about that, and be open with what your expectations are, as well as a clinician that is offering these services to these patients. I also think it's really important to get connected with your own therapist outside of being a therapist yourself. That is something I think the biggest thing I've learned becoming a new professional is not being afraid to be connected to yourself. You're giving all these services, but you also can benefit from receiving them. And so it's definitely taking that jump to do that. And those are probably my two main things: get connected yourself with a therapist, but also be transparent about your boundaries in that space.
Yeah, I absolutely echo everything that Rachel and Grace said. It's important to have people that you can talk to, your own therapist, as well as colleagues who, understand what you're going through. Peer supervision can be really helpful, kind of talking through challenges that you are experiencing, as well as if you feel comfortable speaking to your supervisor about it. Um, Pieces of advice that I found really useful that I've heard from music therapists and other helping professionals like nurses. One, make sure you take time to incorporate music for yourself. Like remember why you chose music therapy, and try to make time to listen to those songs that you love, to play the music that makes you happy, to maybe even use some of your own interventions with yourself. I know that we spend a lot of time uh, preparing music that our clients prefer, and things that are going to work best for their goals, but don't forget about what you love. The second one, keeping like a work-life balance. A tip that I heard from a nurse is she found that she was having trouble uh, kind of stopping thinking about work after she left. So she picked a spot on her commute home where as soon as she passed that spot, she would stop thinking about work. She would let herself, process, kind of ruminate on some things for about 10 minutes. But once she passed that certain spot on her commute, she said, I'm not going to worry about it till I get back to work. So I found that helpful.
Okay, there's another question from the Slido that I want us to touch on. It says, how do you go about negotiating salary and what do you consider a livable wage? And I wanted to start with this question because I think that this is a good moment to talk about some of the different classifications that you might find yourself under as a music therapist, specifically thinking about if you're going to be a contractor or or if you're being employed as a contractor or as an employee. Because at least for me, that vastly changes what I consider to be a livable wage. Because oftentimes, or the way that it should be, is if you are an employee, that also qualifies you for like benefits of some sort, hopefully like health insurance, but not always, like hopefully mileage reimbursement if you are driving a lot, maybe PTO. And I would consider all of those like in my wages package. Whereas like as a contractor, you're paid for like a set price for the time that you are in a session, technically. And so that cost, or you can think about what you're being paid as encapsulating not only any travel time you might have or prep time, but also taxes. Because as a contractor, they don't withhold taxes for you and you will owe taxes at the end of the year. So I've held both positions as a contractor and as an employee, and that shifts how I think about livable wage. And I've worked on the East Coast and in the Midwest, and a livable wage in Maryland versus in Iowa are vastly different. So it kind of depends on where you are. I like to look up the cost of living where I'm going to be and go from there. Yeah. And I wonder if y'all have anything to add about like livable wage, and then we can talk about negotiating salary a little.
Yeah, for me, I'm, gonna be 26 in a hot minute. So the most important thing for me was health insurance. And I knew that working at a hospital, that was probably a better chance, especially I work for University of Pittsburgh Medical Center, which is basically every hospital in Pennsylvania, I think like Maryland and Virginia. So it's a pretty big network. So I was fortunate enough that with my, employment wages package, it came with medical, vision, dental, and a large number of PTO days, which I was very grateful for. So then that sort of made me willing to, I don't even know, like fixate less on the actual salary number, because I was like, these are benefits that I'm getting that are important to me. And as long as I am able to pay my bills with the salary, I would be willing to take whatever starting salary I need if it comes with these benefits. That's just for me and the amount of money I saved. And I do live in a little bit of a, oh my gosh, I do live in a little bit of like a area that has a lower cost of living. I do live in New York. I do live in the East Coast, but I don't live in like New York City or anything. So I think for me, like health insurance and the benefits was the most important in looking at like the total wages package, like other than the salary.
I can add to that. I looked at the workforce analysis through AMTA, and kind of they have like this really cool chart that actually lists out like job title, whether it's like activity therapist, music educator, right? Whatever the job title is, and then what the average like salary was based off this, workforce analysis. So that was helpful just for like a starting base, because I didn't even know where to start, right? But just a good number to look at. And then kind of going, I don't know if we touched on the negotiating yet, but I'll kind of add that in while I'm talking here. At least at my job, every year we have a yearly review. And this is, I think, the perfect time for you to bring up, I would like to get paid more, right? And as we all do. And so when you're going through this, they're analyzing you, right? They're telling you all these great stuff that you've done throughout the year. And then you're like, okay, I've done all this great stuff. Let's now talk about, how can I get reimbursed for all this great stuff I have been doing? Also, I encourage you throughout to track what you're doing. So like for me personally, most of my modality is groups. And so I've kept track of how many groups I do within a week, or how many groups, what topics I've covered within the week. And so I have this tangible item that I can show my manager that says, this is what I'm doing, right? And then also comparing it to places around you. So I've reached out to a lot of other behavioral health facilities in the Kansas City area. How much, if you're willing to share, how much are you getting paid, right? Or what is your average salary? Or what does your workload look like? Simply that, right? If my workload looks like this and your workload looks like this, and we're getting paid similar, right? Let's talk about that, right? So just kind of comparing other places around you, but also taking that yearly review as a time to really review, right? Take that review and run with it. So that would be my tip for negotiating.
I'd love to add something about negotiating salary, if that's okay. So in my first job out of internship, I did not negotiate my salary at all. I was hired by the place that I interned at, and I was just so grateful that they were going to be paying me to do something that I had already been doing for free. And so I just kind of took what they gave me. And I learned a lot from that experience. And so going into my kind of second job, they presented an offer. And one thing that I will recommend is know what your bottom line is. I knew what they were offering me as someone who, as someone who had at the point of entering this job, 2 years of experience. And I knew the experience I was coming in with. I knew what they were going to be asking me to do and what other benefits they were or were not offering. And I knew my bottom line. And someone told me something just in regards to negotiating salary. The worst thing that they can say is no. And if they say no, then that is information that you have. And then you can kind of make a decision moving forward kind of from there. But if you know what your bottom line is, then ask for what your bottom line is. And the worst they can say is no. But a lot of times they won't. They won't say no. They may come back with another offer. But it's a negotiation. So it's meant to be a back and forth.
Kind of going with what Naomi was saying, I had the same experience for my first job where you're just so excited to be a music therapist that you're kind of not catching red flags or things that maybe don't quite add up, and you're just so excited to practice and so excited to get out there and help whoever you're working with. And that got me into a similar situation where it just was not, it was below my bottom line, but I didn't know what my bottom line was. So even if you're fresh out of college, we have quite a bit of training. You do deserve to have the means to do what you need to do and pay rent and do what you have to do as a professional and as an adult. So just because you get to practice, don't take peanuts. Do not just go for it for the fact that you get to be a music therapist. There's definitely something there that can provide for you what you need, whether that's benefits or pay or PTO or what. But wait for that to come, or else it's just not gonna be a productive, satisfying, efficient experience at all for you.
Cool. Oh, sorry.
Yeah. Thanks. I also had a very similar experience to both Maggie and Naomi. And to add a couple extra things, it's important to ask, what are you getting paid for? Like, what things are you doing that you're getting paid for? And are you going to have all the necessary supplies and things that you need to do your job? Are you going to have to provide your own instruments? Are you going to have to provide your own cleaning wipes? Are you going to get paid during drive time? Will you be reimbursed for mileage or, be able to use a company car, fill up with gas? Will you be paid for session planning time? Will you be paid for documentation? One of the first positions that I took, I was only paid per contact hour, or which is like in the session. So essentially everything else I had to provide. And while the hourly rate at first seemed like great to me, once I factored in all of the other things, plus the fact that even though I was an employee, they didn't provide health insurance, I realized it was much below what I was able to accept as a livable wage.
All right, Maggie, we have a very popular question in Slido for you. How do you balance part-time work? This is coming from someone who's hoping to work part-time in music therapy and pursue some other opportunities like music performance on the side. So how do you balance that?
Full disclosure, I'm very new into this. I left my full-time music therapy job in about mid-February. So we're about like a month into kind of doing this. I'm just kind of approaching it with the mindset of like, I really do like being a music therapist. I enjoy the work that I do. I really find it meaningful. But doing it full time was like really proving to be rather difficult for me. And maybe that's because it was hospice and just tough in a lot of ways. And I was also commuting and things like that. There was a lot on the table. I find that I'm really looking forward to kind of how this unfolds. I don't have a great answer on like how to do it effectively because it's so new, but like I'm working in a school, so I'm on school time. And right now I'm kind of talking with somebody about maybe picking up like a PRN position at a behavioral health hospital as an MT to kind of like give a little bit more time as an MT. And then I'm also going to be doing MT work over the summer during the school break, kind of like focusing on definitely not burning yourself out by working like, 10, 12 hours a day. I'm really trying to find that balance. But a really good thing that comes with working in the schools is you have these breaks. Like you have summer. My district functions very oddly. My spring break was 2 weeks long. So I just have these other times to do things. Whether that's PRN work, I took on a client in bereavement who we were not quite done with our project when I left my old job and they really wanted to get there. So just kind of finding that balance of definitely don't end up working 2 full-time jobs. Try to find that balance of like, if your day job is 37, 40 hours, really try to limit kind of what you're doing on the side so that you're not ending up with like a 70, 80 hour work week, because that will just, I assume, make it pretty hard. I don't have a great answer. It's very new, but so far it's going very well and I'm really excited about it.
Awesome. Okay, question for the panel. What was the hardest part about the transition from internship, exam, interviews, and then getting a job? What was the transition between internship and landing your first job as a certified MTBC like?
I guess I can speak on this because I went through the process the most recently. For me, I do not do great with idle time. I need a routine. So for me, the the internship to studying for exam transition was pretty rough because this is a very important exam. And I know some people that do their internships at private practice often will just get hired by their internship right after. However, I had to, my internship would not interview me until I was board certified. So that was an extra weight of like, oh crap, I can't move on with my life until I pass this exam. So that was like just an added weight. So I think that after the exam, everything moved pretty quickly for me. I had 2 rounds of interviews. One was with the manager of the creative arts program and the rest was with the creative arts team. And after that, it's all been moving pretty fast. But I think for me, that idle period between internship and the exam moved pretty slowly, but also had some pressure on it. So I think it just depends, like what does your state require? What does your jobs that you're looking at require? For me, I knew that I couldn't go anywhere until I had the cert. So that was the main thing I had to focus on. But I think it's different for every job, different for every area. But for me, that was the most important part.
For me personally, I knew that coming out of internship, I didn't really have a lot of wiggle room to like take a break financially. And so I knew I needed something like lined up once internship was over that I felt good to transition into. So I actually started my job search while I was in internship, and I had interviews while I was in internship. I was grateful enough that my internship site let me like take days off or go do those, interviews during my time of internship. So that was really awesome. If that's, something that you want to do, I recommend like researching. And what's cool is if you're doing it then your internship director, at least mine, helped me, right? She helped me look for some. She was like, oh, these are great, or maybe not so much, right? She could give you a little, she gave me a little tips and pointers on that direction. So that's kind of how my path looked. I had a lot of interviews set up, and I actually had a job lined up before I was done with my internship, all based off if I did pass the exam, right? So it's like this, you get accepted on this continuum of you pass the exam, come on in, right? So then that lined me up to where I had to, as soon as I was done with my internship and I got that, you're done by your internship director, I immediately signed up for the exam. I think I had like 1 week between the end of my internship and then my exam started, or I took it and then immediately started into my job. So it was kind of a really quick transition, but I personally really enjoyed that because it didn't give me time to like stop thinking about this mindset of being a music therapist, right? It was an easy transition because I've been doing this, right? I've been doing this for 6 months, and now I'm just gonna do it on my own, right? And so but it definitely was a transition of this mindset of being an intern underneath people, and I'm the only music therapist at my facility, and so it's like taking on this independency was a huge transition. And kind of addressing a little bit of what the question that Sydney put in the chat is like, I think that was my biggest thing of moving into the workforce, is putting on this hat of individuality and being able to be my own music therapist outside of my internship was a big transition for me. But now I'm starting to figure it out, right? It takes a little bit of time, but you got it.
Yeah, I'll just echo that last thing Grace said. I would say the hardest part about the transition for me, like I mentioned, was hired by my internship site, which was a private practice. So I had surgery and then studied for the exam and started. So that all kind of happened at the same time. But the hardest part, I think, was kind of like finding who I am as a therapist outside of the like really influential mentors that I had within my internship, especially because we were still working at the same place. And then it was also like navigating those like role shifts as well. Because I went from being kind of like they're my supervisor to then being colleagues, and that really shifted like how we interacted within the workplace as well. So I think it was just figuring out who I am and how I kind of stand separate from the people who influenced me within that workplace. We have like 2 minutes. Maggie or Haley, do you want to add anything?
I guess my transition was, I felt like rather normal. I was very lucky that I was living with my family at the time, so I wasn't in this rush to kind of like get out. But I would definitely say don't harp too much on the studying. Like, you have been trained well. You know your stuff. There are things to study. Me and Naomi met because we were studying for our board exam together. And I think we took, I don't know, maybe like 3 or 4 weeks. And then I was like, okay, I just need to take it. I just need to get it done. And I ended up scoring pretty well on it. So like, trust your own instinct and like that you know what you're talking about with this test. Because I think a lot of people can kind of get stuck on like, oh, well, I've only done internship in like this population and I've never worked in mental health, or I've never worked with like older adults and things like that, that you have this critical thinking that you can figure out these problems on the test. So don't study for 6 months and get nervous that like you don't know enough. You're better off taking it closer to the end of internship when you're like fresh off of working full time and fresh off of having those mentors who are helping you with those things. So just go for it, get it done.
Yeah, definitely reaching out to your resources, doing like study groups. Yeah, I think Naomi at some point, like, we shared resources. That was really helpful. I moved like right after finishing my internship, and I was fortunate enough to have a little bit of time. And something that helped me was setting like a deadline for myself. I was like, okay, I'm gonna, chill for a month, like get settled in, try to do some self-care, but then by March, I'm gonna be scheduling my exam and taking it.
Cool. There's a lot of questions that we didn't get to, but we are out of time. So I'm gonna put 2 links in the chat, some study resources, because that came up a couple of times. And then 2, a Facebook group called Music Therapy Jobs and Hiring. It's can be a nice place to look for jobs, but the reason I'm sharing it is because recently one of the admins of that group did an entire series about understanding the differences between being an employee and being a contractor, and how misclassification can impact kind of like your earnings and like what you should understand. And this person is a music therapist who's studying to become a lawyer. So they provided some really great information. So I'm gonna put the link to that group in the chat as well. I would just type in the search of that group, like misclassification posts, or the person's name, which their name is Jonah Schiff. I'm gonna put that too. And then I'll put some study things in the chat as well. But since we are out of time, I'm wondering if our panelists, if you would be willing to put your contact information in the chat so that folks can reach out with more questions if they have them. Cool. All right, well, thank you all so much for being willing to be a part of the panel. We'd love to continue this conversation later. So reach out to us via email, and we'll take about 2-3 minutes, and then we'll be transitioning into our internship panel. All right, everybody, we are going to jump right back in to our internship panel. We're joined by 4 panelists. Similarly to our new professional panel, if you have any specific questions for our panelists, feel free to drop them in the chat, or you can add them here to this Slido by scanning the QR code or going to slido.com and visiting or putting in the PIN number 1432659. So I'll leave that up for a couple of seconds, but panelists, I'm wondering if you all can introduce yourselves. We'll start with Haley, then Sage, then Amber, then Katie. So Haley, if you can just tell us your name, where you go to school, and where you are in your internship journey process, and if you've accepted an internship, where it's at.
Great. My name is Haile. I'm a student at CSU, and I recently accepted an internship at UC Health Anschutz Medical Campus in January, and I start in July. So I haven't started an internship yet, but I have been through the ringer with the application process. So if you have questions about applying or interviewing for internships, I'm here for that.
My name is Sage Morgan. I am from UMKC, and I currently am an intern at Midwest Music Therapy Services in St. Louis, and I will be done in the next month and a half or so. So I'm towards the end.
Hi, I'm Amber, and I am an intern at Iowa City Hospice, and I'm a student of the University of Iowa. And I am about 8 weeks in on my internship.
I'm Katie, no longer a student, always learning though. I'm a music therapist at the University of Iowa Hospitals and Clinics. I did my undergrad at Wartburg and my internship in Indiana. That's no longer an internship site because that's how old I am. But I'm here just to be your point person, I guess, as internship director, answer any questions you have just from an internship director point of view.
Okay, awesome. So there are already a couple of questions in the Slido. I'll just read them out for you all. This one is for Haile. Can you elaborate on your application process and what you mean by going through the ringer?
Yeah, so I've kind of had a myriad of experiences. I started applying for internships in October, and didn't accept one until January. I had an experience where I got into the final interview and then didn't get an internship that I really wanted. I had an instance where I did an interview at a place and my gut just told me that wasn't for me, and I was offered the internship and declined it. And then I finally had a place where I interviewed, felt really good, felt like it was a good fit, and accepted. So I kind of just have I've kind of done all of it. So if you have any questions about knowing whether an internship is for you based on the interview or things like that, that played a really important role in my acceptance to my current internship. And I had a lot of conflicting feelings about declining an internship because I know there's a lot of feelings of, oh, I've been offered something, I should just take it. But I think it's really important to honor your gut because you will know if something is a good fit or not. And it's okay to say no to an internship site and not just grab the first thing that's offered.
Along the same vein, for everybody, how do you pick the internship that is the right fit for you?
Okay, so when I was applying for internships, I had one in mind that I really, really wanted to go to, and I applied there and thought the interview went great, and then I didn't get it. And I was just kind of lost from that point because I was like, now what do I do? And I ended up kind of shifting my gears completely and going towards the school setting because I had never had a clinical or practicum in a school setting. And I was like, well, I can do something that I don't have experience in and get more experience in that. And I think just after the interview, I kind of had a really good feeling about the company that I had interviewed with, to the point where I had other interviews lined up and I just accepted theirs and went with it because it felt like the right position to be in. Another thing that I was really looking for was having other interns with me, because a couple of the other ones, they're looking at me. A couple of the other ones that I had applied for only took one intern a year. And I really wanted to be able to have people that I could relate to and talk to throughout the process.
Yeah, I could speak a little bit to that too. I would say just making sure that it kind of lines up. Well, for me, that was important to make sure it lined up with what my personal goals were. moving forward. I just wanted to really experience some individual work, and being in hospice, that allows me to tap into that we don't really get to do as much sometimes in school. At least for me, I did a lot of group work. So yeah, just knowing what your future goals are for your growth, and then also maybe for if you can pinpoint where you might want to work, and consider that when choosing.
I have two thoughts about this. My first thought is a lot of people have an idea of the population and setting that they really want to do internship with. And sometimes people get stuck only applying to one type of setting with one type of population, and it keeps not working out. But some of the best advice that I got from an advisor here at CSU was that for internship, the setting and population isn't as important as the supervision style, the learning environment of the internship, because internship setting and population does not determine what your future career will be. And for some people it does matter a lot, and that's fine. But for me, I applied to like a variety. I applied to private practices, I applied to medical, and I really just went with asking a lot of questions about the supervisor and what the style of learning was at that internship, because for me, that was more important than the setting or population that I was working with, because I know the scope of music therapy is huge. And even though I'm doing my internship in medical, I might end up in private practice, or I might end up in mental health, and that's okay. The internship is still going to give me what I need. So for me, I prioritize learning environment. Some people prioritize population and setting. Those are just two different ways you can go.
And I would just say, from the internship director and supervisors choosing interns, it is extremely challenging, and we use that word of best fit. We sometimes will interview somebody or get an application and we all agree, oh wow, they would make a great intern at this particular type of facility, but not our facility for a variety of reasons. So there's always an internship for you, and I know it can feel really discouraging, and we hate to tell somebody like, I'm sorry you didn't get the internship, you weren't the right fit, or you didn't even get an interview. It can be very, very discouraging, but do know that we're coming at it with the very best objective lens that we can, and really want it to be successful for you and successful for us. Our internship is very acute setting, and so it's high demands. You need a lot of good musical skills coming into it, so sometimes that's what we look for, and just that flexibility piece. But me as an intern, I had a very structured internship where I saw the clients for the entirety of my 6 months, and that was an amazing learning experience. So I think you might have an idea of what you want as an intern, but hopefully the people interviewing you can see maybe where you best would fit, and will guide you even by saying no to the right internship. That's all I think I would add.
Awesome. And then Katie, a question specifically for you is, what kind of characteristics and skills do sites tend to look for?
Yeah, I think I touched on those a little bit. It definitely depends on the site and the supervision style. Ours is very, we're very hand in hand with our interns, so we don't just send them out and check in with them once a week. So I think if you're at an internship like that, there's definitely value in that, and amazing for people who really want that autonomy. But they're looking for someone who's extremely independent. We're looking for somebody who has really flexible music skills and can be in a variety of populations. So sometimes it's what you write in your essays. Maybe if they're applying and you're talking, about a very specific objective that, or intervention that you used with a client, and we can see like your excitement in that and your passion, and we can see how that could be applied here. Or if we, if you don't have any mental health experience, sometimes it's about like, what kind of experiences have you had? And we, fortunately, because we've been working for a while, all of us supervisors, we kind of know most of the programs, at least regionally. Some of them we don't know. So if we know, well, they're from this particular program that doesn't have access to that type of practicum, that's no fault of yours. So it's so many different things that we're looking for, but a lot of it is just that flexibility and how you handle not being in that I have a lesson or like a session plan and this goal and objective, and I follow these steps, because that's not always how it is in real life. So showing in your interview that you've had to make an adaptation, I would always have a scenario ready when you go into an internship interview where you've had to change what you planned on doing. I think that's really a good skill that all internship directors would want to see in a student.
Awesome. Thank you, Katie. Okay, a question for the interns. How do you manage the cost of living during internship? Was your internship paid? Was there a stipend? What does that look like for you?
No, there was no stipend or pay of any sort. I was very fortunate to have family friends that enabled me to move away from my family for my internship. But overall, I just really worked my butt off the year before internship and saved up money. And it goes away a lot faster than you think it will. So
Amber or Haley, I guess Amber, you're in internship, or Haley, do you have any prospective things that you're considering doing?
Yeah, I actually, well, luckily, you know, being married, I don't have to worry so much about income, so I get lucky in that way. But I just do a couple lessons on the side to make a little bit of money throughout that time. But other than that, that's pretty much it. And I guess they do reimburse me for mileage, which is nice.
Yeah, I am also probably not the best person to ask this question because I do have the support of my partner. I'm very privileged in that way to have that in this phase of life. In my undergrad, I did student teaching though, which was also unpaid. It was not as long. It was only like 3 months as opposed to 6. Yes, basically get married before you do internship. But I know when I was an undergrad and single and doing student teaching, I worked in the evenings, and I know that that's a terrible answer. And I know this is one of the hardest parts about internship, is that most of them are unpaid, and it was really hard. So yeah, I think Sage gave some good advice of trying to save up before, but that's one of those realities that's just really tough. Sorry.
I know. Oh, sorry. I was going to say I'm many years down the road, but when I applied, I knew I had to have one that was paid. So I only applied to paid internships, as shallow as that sounds, but I was just in a financial situation that that's what I needed to do. And then luckily I got one of those, and then I could work at the place on the weekends as well, and then get paid that way. So it wasn't a lot, but I was able to at least cover most of my expenses. And then I took on a small student loan to cover the rest of my living expenses. But I was in a kind of a small town, but that was truly one of the driving factors of my internship search.
I would also like to add to not be afraid to like reach out for support from family and friends in whatever way you can. And I also just remembered that with school, because we still have to pay for internship for a lot of places, I was able to reach out to the school and explain the situation of like, I'm in a 9-month internship, I don't have funds right now, and they gave me an emergency grant, like scholarship for my tuition for this semester. So you know, go for things that you don't think that you would get, because a lot of the times you will, and other people aren't doing the same thing.
Awesome. Okay. Another question for those of you well, really all of you. What are some good questions to bring to an interview? So questions you're asking the sites through the interview process.
I can start. So the questions that I brought were, how many clients would I have? What does my workload look like in terms of hours per week? Would I have time for a job on the side? Um, how many supervisors would I have? Because in my case, I have 3 different supervisors. And then how many other interns, and do we get a chance to like collaborate on things? And those were kind of the 3 important things for me.
I can also jump in here. I asked a lot about supervision style because I wanted to know if the internship was going to match my learning style. And that was a pretty good indicator of whether or not it was going to be a good fit. I also asked questions about program development because that's a personal career goal of mine, and I knew that my internship director had a lot of experience in that, and so I wanted to put that connective piece. I think anything that you can ask that really shows that you have long-term goals and you want to use internship to work towards those goals is going to help you stand out a little bit. And then, yeah, day in the life of an intern, those kinds of things are great as well. But I really tried to ask questions that were going to connect me to whoever was interviewing me, and also help me figure out if it was a good fit, because as much as they are interviewing you, you are interviewing them. And I think that's something we forget a lot, because we're just like, I need an internship because I need an internship to take the CBMT to be a music therapist, and that's all great. But you want your internship to be enjoyable for you as well. I asked questions about work-life balance. How do you help your interns maintain work-life balance? What are the demands like outside of the workday? Am I going to work 8 hours and then go home and do 5 hours of homework and and session planning? Those kinds of things were important to me. So.
Amber, do you have any questions? Or Katie, do you have any questions you'd like to hear from people interviewing with you?
Oh, yeah, I was just honestly going to agree with everything that Haile said. That's pretty much what I had in mind when I was interviewing. And then, yeah, just those experiences, you know, like I said, I was looking personally for individual, and just what style of learning, because yeah, I'm very much learned through the experience of it, and to make sure that that was going to fit.
I think the one that we get asked the most is about supervision style, and that's helpful. There are 3 supervisors in our internship, so I think, like Haile mentioned, it's pretty telling of what you're going to get and if that's the fit for you. So I know as students, you have a variety of not internship supervisors, but practicum experiences and supervisors, and not all of those are positive. So I guess glean from those what is helpful to you, and make sure that that's a good fit. I'm trying to think of the other things people ask, but it's pretty much what was mentioned. I think, you know, people sometimes ask, like, what's the favorite part of your job, or, you know, things like that, where you can really see the internship supervisors light up or show that they're burnt out. So it might be telling of the internship supervisors of where they're at in their career, of how excited they still are, because you want somebody who's still excited and wants to share with you.
Awesome. For all of you currently in internship, how many hours do you work on average during your internship, both inside and outside of sessions?
That varies a lot. So currently I would say I'm about 30 to 40 hours a week, and that's including like planning, session time, documentation. Mine is based through contracting, so my schedule is different every day. But I would say I typically have like 4 or 5 clients a day, and then I go home and do documentation and planning and other projects for another 3 or 4 hours. So it also just depends on how quickly you're able to do those things. I'm slow, so it's it doesn't go as fast.
Yeah, I would agree with Sage. I see about 4 patients a day, and then either do the documentation right after, or if you're, depending on the time, doing it at the end of the day. So a couple of hours for documentation and just kind of like brushing up on music. But yeah, it's probably ends up being about 40 hours is what I average.
Awesome. Okay. What advice do you all have for connecting and networking with professionals at internship settings you're interested in? How important is that before interviewing?
I would just find some people either in your area or in the setting that you're looking at and shoot them an email. I emailed a lot of people beforehand and was just like, hey, how do you feel about this? What's your job like? Do you enjoy doing this? And that was really helpful. And I think during my internship as well, just not being afraid to like connect with people and ask your supervisors for other people to like talk to about music therapy, and reach out to other professionals. Part of my internship is that we have to observe speech therapy, occupational therapy, and physical therapy as well. And that's a really interesting insight to like see how other professionals do that.
I also would agree that I think it's pretty important to network as soon as you can, you know, and just I was able to observe a couple music therapists before I got into the hospice space just to make sure, because sometimes the idea of what you think something is as opposed to actually seeing and doing it can really vary. So I do think that's important. And it also just gives you a chance to then, when you are done, have people in your community already kind of know your name and what type of music how you specialize as a music therapist. So I do think it's really important.
Okay. Another question for you all is, how did you or are you preparing for your internship musically? And this is like post accepting an internship, kind of going into it. How did you prepare musically for that?
I'm doing that right now, so I guess I can speak to that. I guess, I mean, I can speak to my individual internship experience. I'm not sure how this transfers to others, but as soon as I accepted my internship, my supervisor was very clear about what I needed to do musically to prepare. They sent me a list of repertoire and they said, we need you to know this before your first day. So I'm like cranking away at this list of songs that are commonly used in my setting. Just, you know, a few a week or whatever. It was the same as the interview list of rep, so it's nice I had kind of worked on it prior, but just working on that before I get into internship. And then I'm also continuing to work on skills, partially because of the classes I'm still in, but just those transposition skills and working on specific facilitation skills in my practicum. And I feel like now that I know where I'm going to be, I'm keeping a lot of that in mind as I finish out my last semester of classes to prepare for that specific setting or population.
Yeah, when I first started, I was honestly kind of really surprised with how much music I did not know, because it was from like, it was dating all the way back to like the 1900s. And so it was a little bit shocking at first, but kind of like Haile said, I did get a list prior to really start working on, so that it wasn't so shocking when I started. And then we have the nice little iPads where we can organize all of the songs into different genres. So that's been really helpful. And then they allow you about, I have, like I said, I have about 4 hours a week to kind of touch base with my music that I'm working on and what I need to have prepared for the next week.
I also wanted to add that, so my internship site did not send me anything beforehand. So that was something that I just kind of looked up songs that were popular with different ages and different settings and did some of those. And then just spent a lot of time organizing my rep that I had from school and keeping up with that. But don't be afraid to like ask your internship site either, like what are some popular songs that you use with people, and you'll get them very quickly within internship, just from repetition and listening.
Yeah, we try to send out a songbook. We have an internship songbook and we send that out. We switched our date of starting. So typically we would start in September and then we'd send that out after your school year is over. So it'd be like June 1st, because we knew realistically you're probably not going to have a lot of time to work on that during school. So we'll have to send that out a little earlier, but I think your internship directors know you're busy and we want you to take that time away from school and to replenish yourself. So I wouldn't overly stress. They're just guidelines because music changes all the time and you have so many different patients and clients, and if you're in an internship like Sage's, you're going to be writing up little ditties to go with educational goals and all sorts of things that you can never find and learn before you get there. So it kind of depends on your setting, but even right now we're revising it and it's like, oh, there's such a wide variety of music. What do we tell you to learn? So as long as you have a good groundwork. And then I always find it exciting because interns have their niche set of music. And if it's different than mine, that's even more wonderful because they could fill the gaps in my repertoire and teach me some new songs. So we like to learn from you guys as well. It's not just a one-way street when you come to internship. So come with some ideas and things to share with us.
Okay, I have a question for Sage and Katie. Sage, how did you kind of navigate that process of not getting an internship that you wanted? And Katie, kind of in that same vein, what is your advice for students who are rejected from an internship site and kind of continuing in the process of searching?
Yeah, I think I was very kind of tunnel vision on a specific population and place. And one of the main things for me was that I wanted to leave Kansas City for my internship because ultimately I want to be there, but I've never left. So I was like, I want to leave for a little bit. So I took some time off. I got the email that I didn't get that internship the week of finals during fall. So then I kind of just took all of winter break and didn't think about internships, didn't really play or anything. I just didn't think about it. And then once I kind of picked myself up again, I started looking at other places that could potentially be a good option for me. And I also think just keep an open mind about populations because eventually I did a practicum in the setting that I had interviewed for and I didn't like it. So I'm kind of glad in the long run that I didn't get that one. So yeah, it will eventually work out in the way that it will. And yeah.
Yeah, I don't know what more I can say, Sage. That's great advice. I think don't get discouraged. It's never personal. It's not a personal thing at all. We all know that you're wonderful people. You've done all of your schoolwork. You are qualified. It's just finding the right fit for you. So I think, yeah, stretch your imagination of where you thought you were going to be. Go back and ask your professors, where can you truly see me thriving in an internship? I mean, you can always respond back to the email that you get that declines you. That's can be uncomfortable for us, honestly, because we're like, oh, shoot, I feel so bad, but I can try to give you whatever feedback. But a lot of times it's not the best fit. And I only know this much of you. So to give you any advice to say, oh, sometimes there's very concrete things like your video wasn't that great, or you didn't dress professionally, or I will say that something, when you send videos, wear professional clothing, it looks a lot better than when you get something that's where you're just wearing your normal clothes. Treat it like an interview. So maybe look at your videos that you made and change those a little bit, but just kind of keep going with the process and trust that it'll work out. It will. And maybe decide I want to try something different geographically. That's a little more scary to me, but it's only 6 months of your life. Even if you are married before internship and have the financial means, you can go live somewhere else for 6 months. You'll be fine. They can come and visit, and it should work out just great. So there's a lot of internships. Just keep plugging away at it. You'll get the right one.
Okay, awesome. Another question for everybody. What is some advice that you have about maintaining like healthy self-care habits in internship, and what has that looked like for you?
Yeah, that can be difficult. I think just allowing yourself to stop working at times. Like if you are feeling really overwhelmed and you're like, well, I have all these projects and things to do, just take a break. It's okay. You don't have to be working every second of the day. And that was something that I had to learn very quickly because it was a lot at first. And just remember that like it is 6-ish months of your life, and once it's over, it's over. So it's okay if it feels like a lot, but yeah, just give yourself a break. It's not as crazy as you think it's going to be.
I definitely try to take time to play some of my own music on the side because it reminds me of the reason that brought me to this in the first place. And working with a population such as hospice, it can get a little heavy at times. So just making sure that you're relying on your supervisors, if anything, even just feelings that you're having. Just my supervisors are really good at taking time to reflect on some of those situations. And if there's a heavier visit, taking the time to talk that through with someone so that you can move on and be there for the next people who need you.
Katie, do you have any things that you tell your interns about like establishing healthy self-care habits?
Yeah, I think transitioning from student to intern is a big transition. One of our interns really framed it in the context of grief and looked at it from that lens, like the loss of her community, loss of the place she was living on. And that kind of oriented her to help her understand why she was feeling so much all of the time at the beginning, because it is a huge change. And if you move far away, you are lacking a lot of the social supports, at least locally, that you have. So give yourself grace in the beginning. I think it's tempting to overwork or try to do things in the evening. You're also just very used to that pace as a student. And I found an internship, I had so much time. It was so weird to me. Like you have all of your evenings free essentially, unless, you might have something in the evening for internship. So that was kind of fun to explore hobbies again. But yeah, we try to encourage our interns. We allow them up to 20 hours of work, like outside of internship hours, but that's really more as a benefit for if something happens where they can't get in that day or something like that. It's not expected. So I think training yourself to turn it off and go do something fun, explore the new place where you live. I'm trying to think of some of the other things. Oh, the other big thing, it's no secret that mental health is like issues and illness is on the rise, and most of our students come to us with a lot of mental health diagnoses. And not that you have to tell your internship supervisor that, but be self-aware that if you already engage in counseling and have a therapist, that you need to continue doing those. This is only going to bring that out more. So please do not stop that when you go to internship. Find a way to do that through some remote platform, or find something locally. And we do have some resources for our interns if they need that. Oh, that's funny. Hi, Lindsay. Yeah, so I think maintaining some of those things that you already have in place, obviously keep any kind of medication management. I mean, truly just some of those mental health things that you need to continue. Because as much as we can listen to you and guide you and supervise you, we are not supposed to be your therapist. So we have to really try to toe a pretty narrow line. It can feel like that sometimes, and we don't want to cross over into your therapist. So maintain those things for yourself. And if you've never tried therapy before, maybe try it when you go to internship. You'll learn a lot of great skills, if nothing else, to put into your practice and for yourself. Oh, and on that line, usually your place will make accommodations for you for your therapy. So if you, we've had interns that the only time they can meet is during the day, and we just consider that part of your internship. We don't take it away from your hours. It's part of your mental health, your well-being, your wellness at work. So those things we would be gifted as professionals. We give that to you as well.
Awesome. Thanks, Katie. All right, y'all. So we have like 5 more minutes. So I'm wondering if you all can share just a word of advice or something that you wish you had known prior to going into the interviewing and application process.
I think Sage said this before, but it will all work out the way that it's supposed to. So try not to worry yourself.
This is just a little thing, but we usually offer Zoom or in person. Not every place does that, but that they give you the choice. Truly take the choice. Don't feel like you have to spend a ton of money to come in person, because it'll look bad if you don't. We understand like this position you're in and that you're in school and that we can be far away. So don't make that feel like, oh, I have to choose, or what are they trying to get out of me? Just choose the one that works best for you. That's truly what we want.
Sage or Haley, do you have anything to add?
Yeah, I think just kind of what we've said before of like keeping an open mind about the settings and populations that you're applying to, and that you'll learn no matter where you're at. So just, it'll work out.
Everything that I want to say has already been said, so I think I'll just sit out of this one.
Okay, sounds good. Well, thank you, Amber, Sage, Haley, and Katie, so much for your time. That'll bring us to the close of our internship panel and passages. But before you all go, just want to leave you with some last announcements. We have a few events coming up the rest of this weekend, starting with our first business meeting tonight at 4:15 Central Time. You can access, I'm going to put the link to it in the chat. You can access that business meeting here. In that meeting, we'll start our elections process. So if you're interested in running for a position on the MWRAMTAS board and working with a team to put together passages for next year, as well as kind of be a part of this community in that way, come to that meeting. We'll open the floor for nominations tonight and go over some reports, things like that. And then tomorrow we have Yeah, tomorrow's Sunday. Yes, tomorrow we have our songwriting competition. We will be having 5 students performing their original songs and competing for a scholarship to next year's in-person conference. And this is also serving as a fundraiser for scholarships for the Midwest students. So purchase a $5 ticket, come cheer on your friends. We'll have Sage Morgan, Megan Westphal, Mia Sparks, Abby Dots, and Nettie Benjamin competing. So we hope to see you at our first business meeting tonight and the songwriting competition tomorrow. And then more information about our second business meeting will be shared in our meeting tonight, but that will be Wednesday, March 27th at 7 p.m. Central Time. So thank you all so much for coming today to Passages and being a part of this virtual event, and we'll see you later.